Gentlemen, in the words of Margaret Mead, they say, never doubt a small group of committed citizens can change the world. That indeed is the only thing that ever has. We request this very distinguished, not small, but a gathering of towering and erudite personalities to kindly settle down for us to make sure that we have enough to embrace you all utmost comfortably, and we'd like to make any arrangements if required. And thereby, may I also draw the attention of all the distinguished guests who await outside the hall, kindly join in. We'd like to make sure there is ample sitting space for everybody. We already have amidst us some of the most renowned and the stalwarts from the fraternity join in. Thank you very much. We shall be joined by the Honorable Minister of State any moment now, and as she joins us, we'll request you to extend a resonating round of applause. To find any seats available adjacent to you, please draw the attention of the ones awaiting to grab a seat. And if we could just park the bags if we do not have the person occupying the chair. So just indicate we have a few of our guests. We request you to kindly look at the wave of the hands that are following. Drawing the attention of all the guests who are standing. We have few seats available. Request you to kindly follow the hands that wave. Thank you very much. Ladies and gentlemen, Honorable Minister of State, Health and Family Welfare, Smt Anupriya Patel, amidst us with a louder, a more resonating and a thunderous round of applause. We welcome all the distinguished guests to grace the days. And let that continue until the erudite personas grace the days with their gracious presence. Thank you very much. Distinguished galaxy of visionaries, leaders, and erudite persona. It brings immense felicity to me to welcome you all on behalf of the Department of Health Research and the Indian Council of Medical Research to this epochal event that promises to be an inspiring and an enlightening one. Being unfurled as we commemorate a remarkable milestone, the 113th Foundation Day of ICMR. Yes, we would welcome that. प्रसिद्ध कवि मैथिली शरण गुप्त के शब्दों में भरा नहीं वो भावों से बहती जिसमें रसधार नहीं, हृदय नहीं वो पत्थर है जिसमें स्वदेश का प्यार नहीं. DHR-ICMR. The veterans, this august gathering has been tirelessly working in pursuit of a healthier nation and a healthier world as your solutions transcend boundaries. And ladies and gentlemen, we gather here this morning to applaud and acknowledge the exemplary contributions of the nation's brightest researchers, scientists, academicians, and the support teams who've made significant strides in biomedical research and innovation. These achievements exemplify the spirit of scientific excellence that ICMR has nurtured through both its extramural and intramural funding programs. So with no further ado, we'd like to first of all welcome the distinguished guests on the dais for gracing this epochal event with their gracious presence. And may we please request you, sir, Dr. Rajiv Behel, to kindly do the honors of presenting a warm token of welcome to Honorable Minister of State, Smt Anupriya Patel. We're absolutely indebted to have you with us, ma'am. May I now please invite Srimati Anu Nagar to please present a token of appreciation and warm welcome to Dr. V.K. Paul, ladies and gentlemen, Honorable Member, Niti Aayog. I now request Dr. Manisha Saxena to please present a memento, a warm welcome to Dr. Rajiv Behel, the Secretary DHR, ICMR. And may I now request Dr. Sarita to please present a token of warm welcome to Srimati Anu Nagar, the Joint Secretary, DHR. And also requesting you to please extend a very warm token of welcome to Dr. Manisha Saxena, the Senior Deputy Director General, Senior Financial Advisor, ICMR. Thank you very much. And with that, as per our cultural auspicious beginnings, requesting Honorable Minister of State, Srimati Anupriya Patel, and the esteemed dignitaries on the dais to kindly light the ceremonial lamp. Requesting all the members on the dais to kindly join in. अकबर के दरबार में तो नव ही रत्न थे, ICMR में तो गिनती अब भी जारी है. And why I say that is because this melodious rendition of Saraswati Vandana was brought to you all by none other but the team ICMR. And with that, may we please request you, Ms. Anu Nagar, Joint Secretary, DHR, to kindly welcome this august house with your welcome remarks.
Madam Anupriya Patel, Honorable MOS, Health and Family Welfare, Dr. V.K. Paul, Honorable Member, Niti Aayog. On stage, our Secretary DHR and DG ICMR, Dr. Rajiv Behel, Ms. Manisha. I also welcome Dr. Katoj, our ex-Secretary DHR and DG ICMR, Ms. Richa, JS DHR, Dr. Sangamitra Pati, Additional DG ICMR, heads of divisions at ICMR headquarters, directors of all ICMR institutes, and the overwhelmingly august gathering, the eminent researchers from all across the country. I welcome you all on behalf of DHR-ICMR family. I welcome you to this Health Research Summit 2024, and we also mark and commemorate the 113th Foundation Day of ICMR. We are privileged to welcome you, ma'am. We are encouraged by your presence and look forward to guidance and support from you. We also welcome Dr. Paul. Sir, you have been passionately guiding the department towards existence and more meaningful research. We at DHR, ICMR have been striving to create a rich resource ecosystem. We've been building health research capacity through VRDLs, MRUs, MRHRUs, and diamonds in all medical colleges across the country, strengthening the research governance through easier bioethics and various registries. For uptake of research outcomes to policy and programs, we have been strengthening our resource centers for HTA and Center for Guidelines. We have also been enriching the resource generation at ICMR through expansion of extramural and intramural programs. There is more flavor and more vigor in these programs, both in terms of diversity and funding. Today, as we celebrate our rich legacy, we shall also celebrate the excellence of individuals and institutions in health research. Let us use this summit to strengthen our resolve towards excellence in HR for our country and World Bank and the world, and mainly towards the Viksit Bharat. I welcome you all again. Jai Hind.
Thank you, ma'am. And now, ladies and gentlemen, who other than you, Sir Dr. Rajiv Behel, the Secretary to the Government of India, Department of Health Research, Director General, ICMR, to take us forth, unveil this momentous event with his opening remarks.
Honorable Minister of State, Health and Family Welfare, Smt Anupriya Patel ji, Member Niti Aayog, Honorable Dr. V.K. Paul ji, Anu Nagar ji, Manisha ji, Dr. Katoj, all the other dignitaries of the dais, all the directors of ICMR, and very and most importantly, all the researchers, not only within ICMR, but within this great country, India, who have gathered here today. I'd like to welcome you to today's Research Excellence Summit. We have only two goals in the Indian Council of Medical Research, DHR, and I often say this, and I'll repeat this, that our goal is to facilitate the work of Indian researchers so that they can do one of the two things, and hopefully both of them together. One is to solve the health problems of India and make the health of Indian citizens better. And second is to make India proud on the global stage by their research and innovation. And those two goals are the only two North Stars towards which ICMR has been moving for the past several years under the leadership of so many distinguished secretaries and director generals, and we continue on that path. Last year, we had the first Research Excellence Award after many years of COVID, and that was a smaller affair. It was held in ICMR with about 100 people and was only focused on our own institutes. But ICMR is far beyond its own institutes. It reflects the aspirations of all the medical and health researchers in this country. So from this year, we have done two things. We have said that every year, and this we have now put on the file, on record, every year on our Foundation Day of Indian Council of Medical Research, with its checkered history of 113 years, we will celebrate the Research Excellence Awards on each of our Foundation Days. And the second is that we have included all the extramural researchers in today's award ceremony, awards recognition ceremony. The only thing that I felt as I entered this room, that perhaps we made a mistake, that we had booked a room with only 300 people. So next year it will grow, and we will try to have at least a room where 1,000 or 2,000 researchers should fit. And they should be able to interact, not only get the awards, but interact and also celebrate what Indian research has done. There is a lot to celebrate. COVID showed the importance of medical research in India and how our own researchers stood so tall that we had all vaccine platforms. We had every single vaccine platform on which we had a COVID vaccine. Perhaps even more than the most developed countries in the world, because nobody made a DNA vaccine. We made a DNA vaccine. We also made a nasal vaccine. So those were additions to anybody else that other countries could do. We had testing where around 100 crore tests were done in India at a cost which was just a small fraction of the cost of tests anywhere else in the world. And we are proud as the Indian Council of Medical Research, and I am proud of all of you who participated, who contributed to that effort, not only within the ICMR institutes, but all across India, all the medical research institutions. I think today is a day of celebration. I am extremely indebted to both Madam Anupriya Patel ji and Dr. V.K. Paul that they have come here in this award ceremony to encourage all the researchers who are going to get the awards here. One word for those who did not get an award: there is no reason to be discouraged. Next year and the year after next are all begging. They are waiting for you. And again, I would like to say, do research that is most meaningful, that benefits each citizen of this country. And I am sure that you will not only be known within this country, but across the entire world. Thank you very much, and Jai Hind.
Thank you very much, sir. Ladies and gentlemen, the ICMR-DHR collaboration has undertaken significant initiatives designed to bolster ICMR's contribution to healthcare innovation. And time now to strengthen the healthcare ecosystem by unveiling some seminal launches. At the very onset, we begin with the launch of ICMR History Book. And may I please request you, Honorable Minister of State, Smt Anupriya Patel, Madam, to kindly do the honors and requesting the dignitaries to join in. Bringing to you the ICMR History Book, a book that is a comprehensive chronicle detailing over a century of ICMR's achievements and contributions to India's healthcare landscape. Over a century of ICMR's achievements and contributions being unveiled. More power to you. Thank you. Marching ahead in the series of launches, we now move on to the launch of a groundbreaking initiative, the ICMR Research Infrastructure Sharing Ecosystem, iRISE Policy and Portal, a new platform aimed at strengthening research infrastructure and private sector collaboration. May we have the film, please?
The ICMR Research Infrastructure Sharing Ecosystem, or iRISE, is a bold new initiative to democratize access to advanced scientific facilities in India. Launched after the 2023 budget announcement, iRISE leverages ICMR's extensive laboratory network to empower biomedical research and foster health technology development. For many small institutions, conducting advanced, high-quality research has long been a challenge due to the lack of access to sophisticated equipment and cutting-edge facilities. These limitations hamper the growth of innovative research in the country, and often the only institutes that benefit are those with well-established resources. ICMR's iRISE policy offers a comprehensive solution through its user-friendly iRISE portal. This single-window interactive dashboard enables researchers from medical colleges, universities, Ayush institutions, startups and industries to register, book equipment, seek technical assistance and access ICMR facilities nationwide. The iRISE platform offers access to state-of-the-art equipment and advanced research facilities like animal houses and BSL-3 labs available to researchers across the country. It offers access to critical equipment like high-resolution gas chromatography or mass spectrometry systems, real-time PCR machines, and more. Over 700 medical colleges and 1,000 universities can benefit from this shared ecosystem with incentives for collaboration. iRISE is more than just an infrastructure sharing platform. It is a pivotal part of India's larger Make in India mission, particularly in the fields of diagnostics, therapeutics, and vaccine development. It is a critical step in positioning India as a global leader in biomedical research and health innovation, ultimately improving the health and well-being of its citizens.
And the leadership urges the team to kindly join in at this very epochal moment. We'd like to add faces to this spectacular work. Ladies and gentlemen, joining us is the team behind the launch. Capturing this moment in a photo up here. Thank you. While we move on to the next launch, we'll also request the history book team to also be ready. We'd like to capture this moment for you as well. We request all the teams to start gathering near the dais so that we may please have you here. We now have the launch of the 3 new ICMR guidelines establishing a robust framework to drive innovation, encourage collaboration, and optimize resource allocation. May we have the AV, please?
The Indian Council of Medical Research, ICMR, a pioneer in biomedical research, is committed to build an innovation ecosystem through flagship initiatives such as Intramural, Extramural, MedTech Mitra, First in the World Challenge. To further strengthen the innovation ecosystem, ICMR is unveiling comprehensive policies and guidelines. ICMR's intellectual property policy is poised to play an important role in realizing the vision of Viksit Bharat 2047 by promoting innovation, IP creation, and IP translation. ICMR Guidelines on Technology Development Collaboration establishes a suitable framework for technology transfer, joint development, material transfer, and validation of technologies to boost the growth and capabilities of manufacturing sector for the envisioned Atmanirbhar Bharat. The ICMR guidelines on utilization of corporate social responsibility funds unveils a suitable framework for effective utilization of the funds generated from industry donations for advancing public health, ensuring transparency and accountability at the same time.
And inviting the team to kindly join in this moment of launch. And this is the ICMR guidelines for utilization of CSR funds that guides allocation of CSR funds from PSUs to drive healthcare innovation. These are the 3 ICMR guidelines documents being unfurled one after the other to drive innovation, encourage collaboration, and optimize resource allocation. Thank you. And if we may please request the team of the ICMR history book to please join in. It was only owing to the missing smiles in the hall that this initiative has been thought of by the leadership. So may we please request you all to add some brighter smiles. Thank you very much. And now, our last initiative, and maybe the much awaited one. ICMR has been at forefront of integrating drone technology for medical logistics to advance healthcare accessibility and reach in the underserved areas. Following the vision of our Honorable Prime Minister to advocate advanced indigenous technology under the Atmanirbhar Bharat initiative, ICMR conducted several studies pan-India for drone-based medical supplies delivery. ICMR, in collaboration with AIIMS BB launched the Drone Services for Health Outreach initiative in October 2024 under the leadership and vision of the Honorable Prime Minister, along with the eminent presence of the Honorable Union Health Ministers. Are we ready for this? Are we? So please tighten your seatbelts, ladies and gentlemen, because moving forward to the next phase of the program which extends to implement a district-level model for transporting the TB sputum samples via drones from the rural and tribal areas of Yadadri, Bhuvanagari district, Telangana. We are pleased to welcome you, and we request the Honorable Minister of State, Smt Anupriya Patel, to kindly initiate this sortie, and may we now get transported. Are we ready? The drone that will take off from Marialla Subcenter and Kodamadugu PHC and will land at the TB testing unit, Bhongir in Yadadri, Bhuvanagari district of Telangana. Virtually connecting now, if we can hear the Director AIIMS BB Nagar virtually, as we initiate the transfer of the TB samples to the drone pilot.
Sir, आप इस डबल जा रही ऑडियो.
Director AIIMS BB and the live proceedings.
Namaskaram, I'm from Telangana, Dr. Vikas Bharti, Executive Director, AIIMS BB Namaskar, बहुत धन्यवाद. I'm handing over this box to the pilot of the drone, and this box contains sputum samples taken from the suspected tuberculosis patients. The pilot is keeping it inside the drone, and this will be sent to the tuberculosis unit of Hon'ble. Now, this is helping a lot, this technology, because it will reduce the time for the diagnostics and providing the medicines to the patients in far-off areas, which are difficult terrains, hilly areas in the district of Yadadri-Bhuvanagiri. I'm so grateful to the ICMR and the Ministry of Health and Family Welfare that we are doing it for the first time in the country. And this program, which was launched by Honorable Prime Minister on 29th of October, now is reaching out to the entire district, which will be served as a model district tuberculosis management program and will help in eliminating the tuberculosis from the country under the National Tuberculosis Elimination Program. Thank you very much. Namaskar from Primary Health Center, Hon'ble, and many more sub-centers and PSCs and tuberculosis unit of this district, Yadadri-Bhuvanagiri, are attached with us. I'm so grateful. This technology will be of great help to the people who are in health and looking forward for the relief from the tuberculosis disease.
Thank you. Everyone.
And a press of button to now lead to initiation of sortie. I think the drone was waiting for a louder cheer. कौन कहता है आकाश में सुराख नहीं हो सकता? कौन कहता है आकाश में सुराख नहीं हो सकता? एक पत्थर तो तबीयत से उछालो. Many congratulations and felicitations to all those behind this monumental and epochal work. Well, it did not come all rosy. May we please have a film to take us through the challenges and difficulties that were faced for this application of drone technology.
In the heart of Telangana lies Yadadri-Bhuvanagiri, a district where hilly terrain and dense forests pose significant barriers to healthcare access for its tribal population. Yet, innovative solutions are bridging this gap. The Indian Council of Medical Research, ICMR, in partnership with AIIMS BB-Nagar, is spearheading a groundbreaking initiative to enhance the National TB Elimination Program. This initiative facilitates the rapid transportation of sputum samples and improves access to directly observed treatment DOTS, significantly reducing patient attrition and turnaround time for diagnosis. This one-year pilot project collaborates with state health services to cover key locations in Yadadri-Bhuvanagiri district. It connects remote primary health centers and sub-centers with all 4 district-level TB testing units, ensuring comprehensive coverage across the entire district. By harnessing drone technology, sputum samples are swiftly transported from various healthcare facilities, cutting what once took hours or even days down to mere minutes. These drones not only accelerate TB diagnosis, but also ensure timely treatment for underserved tribal populations. In rural and tribal areas, patients often face substantial out-of-pocket expenses and unnecessary travel when seeking healthcare. Additionally, delays occur when samples are referred to higher centers, and transportation issues can further aggravate the problem. Limited staff availability and infrequent transport services from remote areas contribute to these delays. In the fight against tuberculosis, timely intervention is crucial. Untreated, TB can spread rapidly, affecting many individuals, this project aims to stop TB in its tracks, safeguarding entire communities from this severe disease. Our focus is clear. Timely sputum transportation and testing are essential for prompt TB diagnosis. With swift diagnosis comes swift treatment, delivering life-saving medication to those in need. This project represents more than just a pilot. It is a commitment to a healthier future. By adopting cutting-edge technologies like drones and equipping healthcare workers with the necessary tools and knowledge, we are entering in a new era of efficient healthcare delivery. Together, we are breaking barriers, saving time, and most importantly, saving life. This is the future of healthcare delivery in India.
And inviting now the team drone to please join us. And that brings us to the next juncture. Well, they say quality means doing it right even when nobody is looking at you. But luckily, DHR-ICMR was not only looking, rather minutely observing. And that brings us to this juncture of recognition of excellence. Time now for a plunge into recognizing excellence for path-breaking research and innovation undertaken over the last 1 year. Shall we begin? Do we have the people, the erudite personas being recognized in this hall? Do we have them? Sir, but the missing smile doesn't rectify and verify that they are right here and they are being applauded for their brilliant work. All right, so with that cheer, we begin the presentation with the first category of recognition, the best paper, Extramural. This category recognizes outstanding research that has pushed the boundaries of medical science and contributed significantly to public health. The first recognition for the best paper goes to Dr. Anurag Bhargava for his remarkable study titled Nutritional Supplementation to Prevent Tuberculosis Incidence in Household Contacts of Patients with Pulmonary Tuberculosis in India. A field-based, open-label, cluster-randomized, controlled trial. Joining us virtually, we have Dr. Bhargava. Well, the only reason he's not here in person is another exemplification of his devotion, because he's attending a conference in Bali, which is titled for the Union World Conference on TB and Lung Health. The persistence of working and marching ahead. The next recognition goes to Dr. R.M. Anjana for the impactful study, Metabolic Non-Communicable Disease Health Report of India, the ICMR in DIAB National Cross-Sectional Studies, brings this coveted recognition to Dr. Anjana. Many, many congratulations. The next recognition goes to Dr. J.D. Pandian for his pioneering study titled Secondary Prevention with a Structured Semi-Interactive Stroke Prevention Package in India, a multi-center randomized controlled trial. Many, many congratulations. Dr. Pandian receiving this recognition. Marching a step forward, we now move on to our next category of recognitions, which are Best Paper Intramural. This category celebrates groundbreaking research conducted within the ICMR's esteemed intramural framework. The first recognition in this category goes to Dr. P. Manikam for his insightful study titled Factors Associated with the Unexplained Sudden Deaths Among Adults Aged 18 to 45 years in India, a multi-centric matched case controlled study. Many, many congratulations to Dr. P. Manikam for being recognized for his insightful study. And inviting now for another recognition, Dr. Abhijit Kadam for his exceptional work on safety and immunogenicity of the COVID-19 vaccine in adults in a phase 2/3 observer blind randomized controlled study. Many, many congratulations. And our final recognition in this category is now being presented to Dr. Pooja Bhardwaj for her innovative research on CRISPR-Cas12a based detection platform for early and rapid diagnosis of scrub typhus. And those contributions advance science and healthcare. Thank you. We now have the presentations with the second category of recognition, which is the best innovation extramural. This category recognizes outstanding innovations that have brought us closer to the healthcare future that we have long envisioned. The first recognition for the best innovation goes to Dr. Dipankar Bandyopadhyay, ladies and gentlemen, for Mobilab, the nanotechnology-based, affordable, portable, and easy-to-use multi-diagnostic point-of-care device for kidney, liver, heart, and pancreas disorders. Resounding round of applauses for that outstanding work. And adding now some beauty to the brain, because the next recognition goes to Miss Shilpa Malik for Cerebo, the non-invasive brain injury diagnostic tool. Many, many congratulations. And the next and the final recognition in this category goes to Dr. Itu Singh for TrueNat M leprosy assay based on multiplex real-time PCR. Warmly welcoming you as you get recognized for this exemplary contribution.
Just to inform the team here that the first innovation that we all saw in the extramural category, Mobilab is ICMR DHR COE at IIT Kharagpur. So it's all the vision of our DG and Dr. Paul that we have been trying to work with them to develop this kit for NCD. All basic NCDs they will be able to capture, liver, kidney, and heart function diseases.
And well, after that deep insight,
the Cerebo is again the second device that we saw today in the extramural category was a brain scan device, and this product has been developed. This is an incubator in IIT Kanpur, so it's again a product of ICMR DHR COE at IIT.
thank you. We now move on to the next category of recognitions, which are Best Innovation Intramural. This category celebrates incredible innovations from within ICMR's esteemed intramural framework. Our first recognition in this category goes to Dr. Shyam Sundar Nandi for a colorimetric isothermal assay for rapid detection of the monkeypox virus. And that is a representation of the winners from the NIV Institute. If we have the director, NIV, amidst us, may we please request you to join in.
On
Well, the next recognition again goes to Dr. Shyam Sundar Nandi. And make it a louder one, ladies and gentlemen. This is for poliovirus non-permissive CD155 PVR knockout cells derived from RD cell line as per the WHO Global Action Plan 3 and 4 for handling poliovirus potentially infectious materials in virology laboratories using CRISPR-Cas9 technology. Innovations for Anemia Mukt Bharat team, a continuous effort to ensure an anemia-free India with the efforts of Vardhaman Mahavir Medical College and ITU Kharagpur along with ICMR HQ Medical Devices and Diagnostics Mission Secretariat for Development of Technology, RCN for need assessment, and CSTO for the clinical trials. Will you join me in congratulating the winners of this recognition? Our next recognition goes to the Monkeypox Diagnostic and Vaccines team. This team is a joint effort from ICMR HQ, NIV, NITVAR, DHR-ICMR, VRDL network, 13 CBOs, NGOs, NCDC, BJ Medical College and District Hospital, Pune and Kerala Health Department. So bringing all of India, one after the other, celebrating the dedication and the commitment. And the final recognition in the category, we have the iDrone team. iDrone team is a team project that focuses on the application of the drone technology for vaccine diagnostic samples, medical supplies, delivery for public health purposes. Do we have the team? All right, so this team was a collaboration of ICMR, Lady Harding College, MAHE, AIMS Bibinagar, IIT Kanpur, Ministries of Health and Family Welfare, Home Affairs, Civil Aviation, state governments, paramilitary forces of Assam, and several more. And seeking your encouragement all the more now. Because now, ladies and gentlemen, we have the final set of honorees in the individual category. And the segment is the best PhD student. This category recognizes outstanding young researchers who've demonstrated exceptional dedication and innovation in their respective fields of study. Unveiling the first recognition winner, we have Dr. Sharmi Naha from ICMR Nirbi for her groundbreaking research titled Carriage and Within Host Diversity of MCR 1.1, Harboring Escherichia coli from Pregnant Mothers, Inter- and Intramother Transmission Dynamics. And I repeat, that is a recognition for the best PhD student. And if I can now request Oishika Das and Dr. Pradanya Kamble to please join us nearer to the dais. Inviting now Oishika Das from ICMR Nirbi for her study on the role of gut microbiota, titled AUF1, Knockdown in Mice Undermines Gut Microbial Butyrate-Driven Hypocholesterol. Oh my God, how deep would have the study been, I just wonder. Well, ladies and gentlemen, can I request you all to make it a thunderous one? It deals with the disruption trust of enteric pathogen invasion, possible mechanism of colonization resistance. And finally, Dr. Pradanya Kamble from ICMR NIRRCH for her work on cancer therapeutics. Comparison of anti-trop extracellular domain antibodies generated against the peptide and protein immunogens. And we have, on her behalf, from NIRRCH, kindly do the honors, the distinguished set of guests on dais. So drawing the attention of all the recognition winners, kindly make yourselves available. Next, we'll be having the institutional category Best ICMR Institute, followed by Best Extramural Institute. If we can have all the winner representatives lined up here to ease it up. Thank you. So the next category of institutional recognitions, the Best ICMR Institute. These recognitions honor excellence, innovation, and dedication to advancing biomedical research, setting a benchmark for the entire scientific community. The first recipient in the category, ICMR National Institute of Virology, recognized for its exceptional contribution to virology research surveillance, particularly in the field of emerging infectious diseases. And we'll keep requesting you to make yourselves available. Up next after this category, the Best Extramural Institute. Following government SNT institutes and medical colleges. And if we may now have ICMR National Institute for Research in Bacterial Infections team, commended for its pioneering research in bacterial diseases, AMR, and the development of impactful diagnostics and treatment protocols. We'd like all the scientists of the institutes coming up here to also join in. Recognizing up next, we have ICMR National Institute of Translational Virology and AIDS Research, celebrated for its groundbreaking work in HIV/AIDS research. Congratulating all the esteemed institutions for their relentless pursuit of scientific excellence. And now we have the institutional category, Best Extramural Institute, Institute of National Importance. The recognition which celebrates the Institute's outstanding contribution to biomedical research and innovation, which have enabled them to secure substantial grants and technical support through ICMR Extramural Grant System. The first in the category highlights the Institute of National Eminence, honoring their exemplary efforts. And I'm proud to announce the first recognition goes to All India Institute of Medical Sciences, New Delhi. a leader in medical research and healthcare education, AIIMS has been the forefront for all advancements in medical science, improving public health outcomes in India and beyond. And recognizing up next, the Postgraduate Institute of Medical Education and Research, Chandigarh, ladies and gentlemen, for its distinguished contribution to research. PGMR continues to shape the future of medical education and healthcare innovation, making significant strides in various health disciplines. And Delhi, Chandigarh and Delhi back it is, as we are now recognizing the best extramural institute of national importance, Indian Institute of Technology, Delhi, ladies and gentlemen. For its technological innovations, IIT Delhi has demonstrated exceptional commitment to research, bridging the gap between engineering and medicine, driving significant advancements in health technologies. Best extramural institutes to be ready up next. So now in the category of Best Extramural Institute, Government Science and Technology Institute. In recognition of its achievement in biomedical research, the first recipient is the BRIC Translational Health Science and Technology Institute, an institute that has consistently demonstrated excellence in research and development. Can we have you all up here while we praise you and your exemplary work, playing a key role in India's effort to strengthen healthcare system and foster innovation. We are recognizing the best extramural institutes, recognizing the two exemplary institutions. And recognizing up next, we have CSIR, the Central Drug Research Institute, ladies and gentlemen, an institute that has been long known to be at the forefront of the drug discovery, development, contributing immensely to public health through its groundbreaking research in the field of pharmaceutical sciences. Deep diving now into a category, Best Extramural Institute, Medical Colleges. The first recognition goes to the Christian Medical College, Vellore, renowned for its groundbreaking research, exceptional healthcare services. CMC Vellore has been a leader in medical education and research in India. And landing up next, right from Bengaluru, we have St. John's Medical College, Bengaluru team, a beacon of excellence in both clinical and research domains. St. John's Medical College has made significant stride in improving public health and contributing to innovative biomedical research. Many, many congratulations on winning this recognition. And bringing something now from the land of vibrant colors, Rajasthan, recognizing Best Extramural Institute in the Medical College category. All India Institute of Medical Sciences, Jodhpur it is. With a commitment to research and healthcare innovation, AIIMS Jodhpur has emerged as a key player in advancing biomedical knowledge, improving health outcomes across the region. Requesting the winner representatives to kindly join in. Okay, fasten your seatbelts because it's going to be faster now because it is Best Extramural Institute, Non-Government S&T Institute. The first recognition goes to Vellore Institute of Technology. Renowned for its excellence in higher education and groundbreaking health research, the Vellore Institute of Technology. Recognizing up next, we have the Community Empowerment Lab, a trailblazer in bringing innovative solutions to empower marginalized communities and improve public health outcomes. And honoring up next, Society for Applied Studies, an institution committed to the application of scientific knowledge for betterment of the society, focusing on addressing pressing healthcare challenges in the area of nutrition and maternal health. We take great pride as we acknowledge all of the recipients of the recognitions for their contribution to the scientific advancement. The next category, and requesting you all to be ready, we have the best multidisciplinary research units, followed by the best model rural health research unit and the best VRDL. So the MRUs were set up by DHR in the medical colleges across the nation to promote and encourage quality medical research in country. And the first recognition goes to the MRU at Assam Medical College, Dibrugarh. Are you there with us? A very warm welcome, felicitation to the winner representative. And moving ahead, Nawabo ke Sheher. Tell me who it is. Bilkul, the second recognition goes to MRU at King George Medical University, Lucknow. As we are going higher and higher up, we are accelerating our speed because the Honorable Minister of State has another flight to catch. So please bear with the gush coming up. And the final recognition in the category to the MRU at Dr. ALM PG Institute of Basic Medical Sciences, Taramani. तोड़ लिए सब तारे मैंने, पंख लगाए अरमानों को, आसमान है पूरा मेरा, कहां समंदर मुझसे गहरा। And now the best model rural health research unit. The recognition goes to MRHRU Tirunelveli under the mentorship of ICMR National Institute of Epidemiology for their exemplary work. Well, it is to promote health research at grassroots level and taking technological advances from lab to field that DHR has set up MRHRUs at the CHC level under the mentorship of ICMR. These recognitions are for outstanding contribution to rural health research, making a tangible impact on improving health and well-being of rural communities. And up next is the category Best VRDL in Scientific Research. And I can't see who the winner representative is. Is it somebody again from Lucknow? Well, it is the state level VRDL at King George's Medical University, Lucknow. These labs tackle the outbreak of viral infections and reducing the turnaround time, as well as for creating more capacity for the virology research. Calling up next, regional level VRDL at Jawaharlal Nehru Institute of Postgraduate Medical Education and Research, Puducherry. The representatives of Jawaharlal Institute and bow down next, ladies and gentlemen, because now we are going to the land of Tirupati. Well, it is the state level VRDL at Sri Venkateshwara Institute of Medical Sciences, Tirupati, being recognized up next. And that is state level VRDL at Sri Venkateshwara Institute of Medical Sciences, Tirupati, being recognized. Coming up next in the category Best VRDL in Public Health Measures, we are proud to announce recognition to state level VRDL at King George's Medical University, Lucknow once again. And please circle back the winner representatives from Jawaharlal Institute of Postgraduate Medical Education and Research, Puducherry, to once again grab another recognition. And that is the second recognition in the Best VRDL in Public Health Measures. Regional level VRDL at Jawaharlal Institute of Postgraduate Medical Education and Research, Puducherry. All right, which part of Rajasthan up next? Let me hear it from you. Come on, let's do that. And the final recognition goes to state level VRDL at SMS Medical College, Jaipur. And it feels right to witness you all brimming with happiness and smiles. Next, we'll be having Best HTA in Center and the best emerging HTA in center. Are we ready? Or tired? Okay. Proud to announce the winners of this esteemed category. Recognitions. 2 HTA in center at ICMR, National Institute for Research in Reproductive and Child Health. The best HTA in center recognition. The HTA in centers have been set up by DHR in government research institutes to provide safe, clinically effective and affordable technological health solutions to the entire country. And counting once again on the greener Chandigarh, we have the HTA in center at Postgraduate Institute of Medical Education and Research, Chandigarh, joining us next in recognition as the best HTA in center. And next category, the best emerging HTA in center, the next institutional category, so to say, and the recognition goes to Indian Institute of Public Health, Gandhinagar. And the next category sparkles up bright as they are the best diamonds center. The first recipient of the recognition in this category goes to Diamonds Center at CMC Vellore, known for its exceptional work. And join me in speaking this time in advancing diagnostic technologies and providing invaluable service in molecular oncology. These initiatives play a pivotal role in advancing early diagnosis and treatment of cancer through cutting-edge molecular diagnostics. And we celebrate 2 such centers today. Inviting now the next one, the Diamonds Center at JIPMER, Puducherry, whose dedication to advancing oncology diagnostics has significantly improved cancer care outcomes in the region. Onboarding next, the Chennai Express, because now we bring to you the best emerging Diamonds Center. The next institutional recognition goes to Diamonds Center at the Cancer Institute, Chennai. Up next, time to recognize the exemplary work of the teams who've provided outstanding administrative and financial support in advancing biomedical research. Time now to present the research support system recognition to those whose efforts in administration and support services play a crucial role in ensuring smooth functioning of research operations. And only if you agree with me on the role they play, ladies and gentlemen, join me in welcoming the first recognition winners, the Central Procurement Cell, ICMR HQ, for their exemplary work in ensuring efficient procurement program and processes that support ICMR's research endeavors and help facilitate seamless operations across the organization. And Bhuvaneshwar, please be ready up next. And inviting now ICMR Regional Medical Research Center, Bhubaneswar, for their outstanding administrative support, ensuring that the regional center continues to be a hub of excellence in health research and innovation. Ladies and gentlemen, the recognitions are ongoing, and please join in applauding all of the brilliant work. And how overwhelming it is to be joined by the Director, ICMR. ICMR National Institute of Occupational Health comes up next for their exceptional administrative contribution for the success of research projects promoting occupational health research. Applauding the invaluable contributions. Up next is the last and the final segment, Research Support Team Accounts. So recognizing next those who've played a crucial role in ensuring smooth and efficient management of funds, helping research initiatives thrive and achieve their goals. Can we please have you, Research Support Team Accounts, ICMR Regional Medical Research Center, Bhubaneswar. Their exemplary contribution in managing the financial aspects of research projects, ensuring compliance and supporting the success of multiple research initiatives. Calling up next, Extramural Grants Accounts Team, ICMR HQ, for their excellent handling of the extramural grant management process, facilitating seamless financial operation and supporting numerous innovative research projects across India. And the last and the final recognition, we honor the ICMR National Institute of Occupational Health. So you're not allowed without a smile. So the accounts team has provided invaluable financial support, ensuring successful occupational health research programs. And now with these words, we'll get the curtain falling off from the recognition. परिंदों को मिलेगी मंजिल, ये फैले हुए उनके पर बोलते हैं. परिंदों को मिलेगी मंजिल, ये फैले हुए उनके पर बोलते हैं. वो लोग शायद अक्सर खामोश रहते हैं, जिनके हुनर बोलते हैं. Recognizing each and every person, team and institution who's played this role, which is non-pareil, in advancing a healthier and a brighter tomorrow across the nation and the globe. Well, inviting him and introducing him would be as daunting a task as showing light to the sun. So with no ado, may we please have the honor to hear from you, Dr. V.K. Paul, Honorable Member, Niti Aayog. Ladies and gentlemen, to please address us.
Thank you and good afternoon. Namaste. Honorable Union Minister of State for Health and Family Welfare, Madam Anupriya Patel ji, Secretary DHR, DHR-ICMR, Dr. Rajiv Bahal, Manisha ji, Anu ji, respected Dr. Katoj, directors of the ICMR institutions, the distinguished invitees, and above all, those who have received the prizes and those who are here to cheer the celebration of excellence in medical research. I'm very honored to be here. It's a very extremely heartwarming meeting. It is a meeting which gives us goosebumps. One, because we are seeing stellar achievements, and I'm going to give some examples which have touched my heart, and also gives us a hope and confidence that our journey ahead to match the very best in the world is really possible. We have the wherewithal, we have the capabilities, we have the intellectual and the scientific insights and the capital to deliver on that. The sole aim of this generation and this generation is to enable our nation to become a developed society by 2047. This vision of the Honorable Prime Minister has caught the imagination of all of us. And I would push that frontier by saying that each day, all of us, in our own sphere of work, should think what we are doing to make that difference, make that difference toward that goal. Because we, the Amrit Kal generation of all ages, will be seen to have achieved that goal if we do so, and if we falter, we would be seen as having missed an opportunity, which is not the choice. Our choice is the former. The Honorable Prime Minister has stated that Viksit Bharat, Nirayamay Bharat bhi hoga. India without disease, India which is healthy, India which is healthy in physical sense, spiritual, and of course mental health-wise. So in that endeavor, today we see tremendous achievements of our fraternity of scientists in the space of biomedical and health research. I'd like to congratulate DHR-ICMR Secretary DHR for his leadership and the entire team of ICMR for pushing the frontiers further, building on what the leadership of ICMR had achieved so far. We are so happy to see the frontiers are being pushed, new ways of promoting health research, biomedical research are being seen. And one difference that you might notice is a clear focus on ultimate deliverables which make a difference. We have excelled in our own way in the basic science research, looking at potential molecules, description, some development, but I think it is clear today that we are celebrating the success of research and all the hard work and the entire pipeline of hard work and research that takes us to products. Such a pleasure, for example, to notice that we have a point-of-care diagnostic for hemophilia. First time in the world. A big applause for something that is done for the first time. I'm so fascinated to know that we have a point-of-care diagnostic for chronic liver disease and chronic kidney disease and so on, and pancreas. I never thought that we will also have a point of care for pancreatic disease, which is the next frontier, truly. And I guess this might actually be, again, the first in the world. The reason why I say that is because our endeavor to address the issue of non-communicable disease has been hampered by the fact that these point-of-care diagnoses for kidney disease and liver disease in particular were not there. And I must tell you here the importance of this being that whereas there are 250,000 deaths due to diabetes, there are 220,000 deaths because of kidney disease and 200,000 deaths directly because of liver disease. So we did well with having a diagnostic for diabetes, but these two chronic diseases, we had no way to make a headway for. Today I can see this and much more, and we of course saw other products. This is just to emphasize the fact that we are making progress from the research in the lab, the bench research, the translational research, the community validation studies, as well as making a difference in terms of medical technologies products. So it's a day of celebration. The only point I would like to tell the audience here, but even more so, the audience which is outside this on the remote system, is that this journey of excellence is is a must for our nation. We have to compete out other nations. And the only way we can do it to perform to the highest level of quality, highest level of excellence. There is no other choice. We cannot be laggards. This period, Amrit Kal, cannot be wasted. And if we are not touching the highest level of excellence and quality, other nations will outsmart us. Be very clear about this. And therefore, I adore the work that you're doing. And on excellence, what I said is, we are what we are, what we do repeatedly. We are what we do repeatedly. And excellence, therefore, is not an act, but a habit. हमें एक्सीलेंस रोज़ दिखाना है. जो लोग यहाँ पहुँचे हैं, इन्होंने रोज़ उस चीज़ को करके दिखाया. और जो बाहर हैं, सुन रहे हैं आज, ये मेरा मैसेज उनके लिए है. क्योंकि अगर हमने इकट्ठे होकर एक्सीलेंस की परिकाष्ठा पे ऊपर आना है, तो एक्सीलेंस रोज़ दिखनी चाहिए. ये कभी कभी एक्सीलेंस दिखाना जो है वो पोटेंशियल है हमारा. जब हम रोज़ दिखाते हैं तो वो एक वे ऑफ लाइफ है, वो कंट्रीब्यूट करता है सोसाइटी को. सो मेक एक्सीलेंस a habit. This is the message I like to give to my fraternity of scientists across the nation. I'm very honored to be here. A day of great joy and celebration. Thank you, ICMR. Thank you, DHR. Jai Hind.
Thank you, sir, for your sagacious address. Vision without action is a daydream, and action without vision, a nightmare. Intertwining the two with her exemplary visionary leadership, we are beyond indebted to have amidst us Honorable Minister of State for Health and Family Welfare, Smt Anupriya Patel, to grace this momentous occasion. We earnestly look forward to hearing your pearls of wisdom.
Dr. V.K. Paul. Dr. V.K. Paul, Member Niti Aayog. Dr. Rajiv Behel, Secretary DHR and DG ICMR. Ms. Anu Nagar, Joint Secretary DHR. Ms. Manisha Saxena, Senior DDG and Senior Financial Advisor. Esteemed guests, ladies and gentlemen, a very good morning and a very warm welcome. It's a profound honor to stand before you all on this momentous occasion as we celebrate the 113th Foundation Day of the Indian Council of Medical Research. And today, when we meet here for this Foundation Day, we're not just commemorating an institution, but we are here to celebrate the legacy of scientific excellence, innovation, and an unwavering commitment to improve the health and well-being of all our citizens. For over a century, the Institute has been the cornerstone of India's biomedical research landscape, and over time, it has adapted and evolved to meet the ever-shifting and ever-changing health challenges of a diverse population. ICMR has made significant contributions from combating infectious diseases to helping us address the big challenge of the COVID-19 pandemic, and it has consistently been at the forefront, guiding the national policy and action based on its evidence-based research and policy recommendations. Hence, my dear friends, this day is not just a marker of time, but it is a testament to the relentless pursuit of knowledge and the enduring spirit of service that the Institute ICMR has. Today is also an opportunity for us to remember and honor all the visionaries who laid the foundation of this institute, and our team of dedicated scientists and the entire staff who have been constantly involved in propelling this mission forward, and also a day to remember the countless lives which have been touched and transformed by the work and contributions of ICMR. On this occasion, I would also like to acknowledge the remarkable contributions of the Department of Health Research to our nation's research ecosystem. the department's commitment to constantly bring modern health technologies to the people through research and innovations related to diagnosis, treatment, and vaccines is truly commendable. Their tireless efforts have improved the healthcare outcomes and enhanced the quality of life for millions and earned India a respectable place on the global healthcare map. DHR has successfully undertaken many new initiatives also in its 100 Days Viksit Bharat program, including the Young Medical Faculty PhD program, establishment of the technical resource centers across the country, to develop world-class evidence-based guidelines, and the conduct of the Vishanu Yudh Abhyas, a mock drill under the National One Health Mission, among others. I also extend my sincere appreciation to the dedicated team at DHR and ICMR under the able guidance and leadership of Secretary Dr. Rajiv Behel, all the dedicated scientists, entire staff, for your dedication and commitment in this pursuit of excellence. We're also having DHR-ICMR Health Research Excellence Summit 2024 today, so it's a day to recognize the outstanding contributions of those individuals and institutions who have advanced biomedical research in the country. Just a few minutes back, we have conferred awards in multiple categories: Best Paper, Best Innovation, Best PhD Student, Best Research, Best ICMR Institute, Best Intramural Institute, and so many different categories. These accolades are not just trophies, but they symbolize the relentless quest for excellence and the spirit of inquiry that drives scientific discovery. And by recognizing these exceptional contributions, we make an attempt to inspire the future generations of our researchers and scientists to dream bigger, to explore further, and continue innovating relentlessly. Friends, we've also seen the launch of various pioneering initiatives today in the form of the ICMR I-RISE policy, which you know is an effort to allow the smaller institutes and the startups to share the equipments and resources and the advanced infrastructure facilities of our institutes to be able to advance the research ideas and concepts that they have, and not allowing their talent and potential to be hindered by the lack of resources. Another very important initiative that we took today is regarding bringing out a guideline for developing collaborations for technology partners, which means the academia, the industry, and the government must be brought together for us to be able to take the research from the lab to the society and bring the benefits of innovations to the country as a whole. Developing guidelines for the utilization of CSR funds for health initiatives is another pioneering initiative that was launched a few minutes back, and it aims at ensuring that the CSR commitments of the corporates get utilized in the right direction, which is towards the national health priorities. ICMR also has an IPR policy now to protect and safeguard the intellectual contributions of our researchers and to facilitate the partnerships and commercial opportunities for innovations to reach the society. And lastly, we saw the innovative healthcare delivery model, which was a partnership between AIIMS Bibinagar and ICMR, wherein the drone technology is being made use of to cut down on the transportation time for bringing the medical supplies and samples in order to facilitate and speed up diagnosis and treatment. I'm very happy to see how drone technology is transforming the delivery in the healthcare systems. And most importantly, today, we have made an attempt to come out with a comprehensive chronicle of ICMR's illustrious history. The Science of Saving Lives is not just a book. It's a tribute to the relentless pursuit of knowledge and the indomitable spirit of those who have dedicated their lives to advancing medical science in India. From pioneering research in malnutrition and maternal health to leading the fight against infectious diseases and responding appropriately and timely to the pandemics, ICMR's contribution have been pivotal. This book delved into these milestones and offering insights into the challenges which were faced in the 113 years long journey, and also the strategies which were employed by the team at ICMR to overcome them with time. This book will serve as an inspiration to the current as well as the future generations of the scientists and remind us all of the profound impact that the dedicated research and innovation can have on the society and the nation as a whole. Friends, as we celebrate the 113 years of ICMR's excellence and dedication, I reaffirm the government's unwavering commitment to supporting health research and innovation. The challenges before us are complex: emerging diseases, lifestyle diseases, environmental impacts on health, and many more. Addressing them requires a robust research foundation, interdisciplinary collaboration, and a willingness to embrace new ideas and technologies with time. But together, we can ensure that India continues to be a leader in biomedical research and public health. On this occasion, let us harness our collective expertise, resources, and passion to drive advancements that not only benefit our nation, but also contribute to global health solutions. I once again extend my heartfelt congratulations to all the awardees and the participants and the whole team at ICMR. The awardees, especially your work embodies the spirit of innovation, which is required to propel our nation forward. You're the catalysts of change and the architects of a healthy future for India. Let us all continue to collaborate, innovate, and strive relentlessly towards the goal of health for all. And let this celebration today be a reminder of what we have achieved in so many years and a clarion call for what we can accomplish together in future. Once again, congratulations, best wishes, and my greetings to ICMR and DHR. Thank you very much.
Our gratitude abound to the Honorable Minister of State Health and Family Welfare, Smt Anupriya Patel, for enlightening this august house with her pearls of wisdom. And it's indeed our proud privilege to now have a special message come in right from Shri J.P. Nadda, the Honorable Minister of Health and Family Welfare. May we please have the visual.
It gives me immense pride to address you all on this remarkable occasion of 113th Foundation Day of Indian Council of Medical Research. Today, we celebrate over a century of ICMR's unwavering commitment to advancing health research and improving the lives of millions. ICMR has been at the forefront of biomedical research, playing a pivotal role in addressing some of the most critical health challenges. From combating infectious diseases like tuberculosis, malaria, and COVID-19 to advancing solutions for non-communicable diseases, maternal and child health, and nutritional disorders, ICMR has left an indelible mark on India's healthcare landscape. Today, ICMR celebrates its legacy while honoring exceptional contributions in health research and innovation. Recognizing excellence in research is crucial as it highlights the dedication and breakthroughs achieved by our scientists and serves as a powerful motivator. By acknowledging these achievements, we aim to foster a culture of innovation and perseverance, encouraging more individuals to take up the cause of health research for the benefit of our society. The spirit of research is built on continuous improvement and collaboration, and every scientist plays a very essential role in our shared journey. As we move forward, let this recognition be a reminder that every effort matters and that there are always new opportunities to shine. I am happy to
Madam, for being here with us. V.K. Paul, the Honorable Member, Niti Aayog, requesting you once again, sir, to kindly do the honors. And now inviting Ms. Manisha Saxena, Senior Deputy Director General and Senior Financial Advisor, ICMR, for the vote of thanks.
सुश्री अनुप्रिया पटेल, माननीय राज्य मंत्री स्वास्थ्य एवं परिवार कल्याण मंत्रालय, प्रोफेसर वीके पॉल, सदस्य नीति आयोग, डॉक्टर राजीव बहल, सचिव स्वास्थ्य अनुसंधान विभाग, महानिदेशक ICMR। आज हमने स्वास्थ्य अनुसंधान में आ रही नवीन ऊर्जा को सेलिब्रेट करने के लिए थोड़ा सा प्रयास किया है। आज आप लोगों की उपस्थिति से ना हमारे अभिनंदित वैज्ञानिकों की उपलब्धियों को हमने मूल्यवान बना दिया, अपितु सभी अन्य वैज्ञानिकों भी उसी राह में आगे बढ़ने के लिए अभिप्रेरित किया है। मैं सबसे पहले माननीय स्वास्थ्य एवं परिवार कल्याण मंत्री JP नड्डा जी का धन्यवाद देती हूँ, जिन्होंने यहाँ पे व्यक्तिगत रूप से उपस्थित नहीं हो पाए अपनी व्यस्ततम समय की वजह से, पर उन्होंने अपने शब्दों से हमारा मार्गदर्शन किया। मैं माननीय राज्य मंत्री सुश्री अनुप्रिया पटेल को भी बहुत बहुत धन्यवाद अर्पित करती हूँ कि उन्होंने अपने व्यस्ततम समय से हमारे परिवार के सदस्यों को प्रेरित करने के लिए समय निकाला। मैं अभिभूत हूँ उनके व्यक्तिगत जुड़ाव से, जिसके साथ उन्होंने इस कार्यक्रम के हर अभिनंदित श्रेणी को समझा और उनकी प्रशंसा की। मैं धन्यवाद अर्पित करती हूँ डॉक्टर पॉल को, जिन्होंने इस कार्यक्रम के लिए बहुमूल्य समय निकाला और हमेशा की तरह जज्बे के साथ और फोकस के साथ आगे बढ़ने के लिए प्रेरित किया। उन्होंने श्रेष्ठता को इसी तरह अनुसरण करते रहने की प्रेरणा दी। मैं सचिव DHR और महानिदेशक ICMR के लिए भी धन्यवाद देती हूँ, जिनके अनथक प्रयासों से ICMR को नई दिशा मिली है और इस कार्यक्रम के लिए भी उन्होंने एक विज़न दिया है, जिससे कि हमें प्रेरणा मिलती रहेगी। मैं अपने सभी मीडिया साथियों को भी धन्यवाद देती हूँ कि उन्होंने हमारे प्रयासों को कवर करने के लिए समय निकाला। मैं संयुक्त सचिव ऋचा खोड़ा एवं अनुनगर का भी उपस्थिति और सहयोग के लिए धन्यवाद देती हूँ और डॉक्टर संगीता पति अतिरिक्त महानिदेशक को भी धन्यवाद प्रेषित करती हूँ। इसके साथ ही मैं सारे अभिनंदित करती हूँ सारे अनुसंधान कर्ताओं को, संस्थानों को, उनको खूब उनके अचीवमेंट के लिए बधाई देती हूँ और आगे बढ़ने के लिए उनकी प्रयासों की प्रशंसा करते हैं। मैं अपने सभी ICMR संस्थानों एवं अन्य ICMR संस्थान जो कि हमारे साथ स्वास्थ्य अनुसंधान के कार्य में जुड़े हैं, उनको धन्यवाद देती हूँ। अंत में यहाँ उपस्थित सभी गण्यमान्य सदस्यों को मेरा बहुत बहुत धन्यवाद। मैं आशा करती हूँ कि इसी तरह अनुसंधान श्रेष्ठता एवं भारतीयता को हम सेलिब्रेट करते रहेंगे। धन्यवाद। जय हिंद।
बहुत बहुत आभार. And may I request you all to kindly rise for the national anthem and also sing along utmost proudly.
नायक जय हे भारत भाग्य विधाता, पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा, विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंगा, तब शुभ नामे जागे, तब शुभ
And with that, we draw curtains to the inaugural session and extend our sincere most gratitude to the eminent dignitaries for gracing this session. Ladies and gentlemen, the ground floor now awaits to welcome you. All right, a special mention has come for the media house here. We would like to also extend a heartfelt note of gratitude for being present here amidst us. And continuing, the ground floor awaits you, the exhibition area first, and thereafter the scrumptious lunch, which is at the Nalanda Hall, and the exhibition at the Shakuntalam Hall, both at ground floor. We resume with the proceedings for the day at 2 p.m. Thank you very much for your gracious presence and active participation. Thank you. Known as the Viral Research Diagnostics Laboratories or VRDL scheme, it aimed to establish a nationwide network of laboratories for managing outbreaks. VRDLs support the health systems in timely diagnosis and identification of viruses, generation of data on viral diseases for effective resource deployment and life-saving measures, and facilitation of research projects to inform public health policy. And medical college labs have BSL-2 level facilities that can diagnose moderate risk pathogens like dengue, chikungunya, influenza, SARS, Zika, hepatitis, measles, etc. Through their state-of-the-art equipment, VRDLs have successfully cut diagnostic time for various pathogens from 7 days to 24 to 48 hours. This, combined with their capacity to diagnose up to 25 to 30 viruses of public health importance, has made VRDLs a critical pillar in India's outbreak management and disease surveillance system. Over 1,100 personnel trained in various viral diagnostic techniques work across the labs. The network's coverage has extended to even the most remote areas, ensuring comprehensive support for virus detection and diagnosis across the length and breadth of the country. VRDLs have established high-quality diagnostic standards, strengthened event-based surveillance for rapid outbreak detection, and streamlined coordination with World Health Organization. will be chaired by Dr. Rajiv Behel, Secretary Government of India, Department of Health Research and Director General, ICMR, and in the august presence of Ms. Richa Khoda, Joint Secretary, Department of Health Research, and Dr. Smt Patel, the Additional Director General, ICMR. As they grace the days, may we see how good the lunch was? We'll judge that based on exactly this volume. All right, so if I may please draw the attention of all the presenters, as says the time, we are strictly to confine the presentation timing to a 5-minute window, and thereafter we might lose the control of sound here. Beginning right away, we have the presentation of best papers to commence with. Extramural first, and joining us virtually is Dr. Anurag Bhargav, who's going to share about his research. Over to you, sir. By the time we are connecting, may I please take this opportunity to first invite Ms. Richa Khoda to kindly set the opening remarks, if you'd like to, for the session. We'd request you, sir, Katosh sir, to please join us on the dais. A humble request.
Respected Secretary, sir, Sangamitra ma'am, and the August gathering. It is my privilege to introduce the technical session for this year's DHR-ICMR Health Research Excellence Summit. These sessions are designed to showcase the remarkable achievements of our research community while also charting a course for the future of health research in India. There were 2 technical sessions. The second one was to be chaired by Dr. Vinod Paul, but he had to leave due to some other official engagement. So we begin. The sessions would be, the first would be a short presentation from the winners in the individual categories, Best Paper and Best Innovation in Intramural as well as Extramural category, showcasing exemplary work in various research domains. Thereafter, we would have a presentation by the best teams highlighting their innovative contributions. Dr. Sangamitra Patel would summarize the discussions and provide key takeaways. This session promises to be an enlightening dialogue offering strategic insights for advancing healthcare research in India. Through these sessions, we aim to foster a culture of excellence, collaboration, and innovation that will help us navigate the complexities of public health in a rapidly changing world. I extend my heartfelt thanks to the session chairs, presenters, and participants for their invaluable contribution. Your collective wisdom and experience will undoubtedly inspire new ideas and solutions. Thank you.
Thank you, ma'am. Just wanting a clearance there. Are we connected to Dr. Anurag? He is joining us virtually. May I meanwhile please request Dr. R.M. Anjana to kindly be prepared. We might call you any minute if technology doesn't sail us through. All right, may we please have you? We'll begin with the session. And over to you, the entire topic, the research, the learnings, all of it, all to you.
Could I have my slides, please?
The other one, please. Next presentation. Those who are making the presentations, second wali. Hanji.
How do I operate the slides? Is there a pointer or to operate the slides?
Next bol dijiye.
Sir?
You say next, they will change.
Oh, we'll say next. Okay, sir. Okay.
Because
Yeah, I think she's just... So thank you very much, sir, for this opportunity to present at today's meeting. So I'm going to be presenting on the ICMR INDIAB study. Now, this is a study that's been funded by ICMR and DHR and has taken 15 years to finish. The primary objective of the study was to look at the national prevalence of diabetes and other metabolic NCDs state by state. It's a cross-sectional door-to-door survey of individuals aged 20 years and above. We've covered the entire country, so all the 31 states, even the islands have been finished now, but in this particular publication, the islands are not included, with a total sample size of 1,20,000 individuals in the study. We have urban and rural areas covered according to the census of India. In order to get a representative sample of India's 1 billion population, ICMR sat with us for about 2 years to put this methodology in place. We have stratified based on 3 stages: the population size, the geography. We've used the NFHS framework and then looked at socioeconomic status, etc., to get a truly representative sample of individuals in every state. So in all individuals, we have structured demographic information, all health information. We did capillary OGTTs on everyone who did not have known diagnosis of diabetes. We have anthropometric measures, blood pressure. We have venous blood for lipids, A1C, and creatinine across the country, food frequency questionnaires and ECG. This is in 1 in 5 population, and more information in diabetic individuals. It was done in phases, and today we have data in this study in 113,000 individuals. This was the publication that came out in June 2023. So the prevalence of diabetes in the country, putting all this together, is 11.4%. It's double in urban areas compared to rural areas. And if you put that on a map of India, you can see that the entire, this is 10%, color-coded map, 10% and above is red. Entire urban India is red. Rural India, central areas have parts of green. But the importance here is that once you start looking at pre-diabetes, first of all, the prevalence is 15% higher than diabetes. So this is like something waiting to happen. People go from normoglycemia, pre-diabetes, and then diabetes. So this is a pre-stage. People with pre-diabetes, 60% of them convert into diabetes in our country. So this is something that's waiting to happen. And in pre-diabetes, there's no difference between urban and rural areas. So what does that mean? It means that for every percentage prevalence increase in pre-diabetes in rural areas, 70% of India lives in her villages. So much more millions of people with diabetes will convert shortly. Drawing your attention to this map, red here means 15% prevalence and above. Look at the pre-diabetes map. Entire central India, which was green earlier on, is red in the pre-diabetes. So it's all of those regions, huge numbers of people, burden of population, that's going to start converting to diabetes. Now, what about obesity? If you thought that the diabetes numbers were big, look at these numbers. A quarter of the population this is generalized obesity by BMI. But if you look at abdominal obesity, 30% of the population, much more in urban areas and much more in women. So again, on the pathway here, you have obesity, pre-diabetes, diabetes. All these are harbinger of problems to come. Hypertension, 35%, and if you look at dyslipidemia, again, a quarter of the population has a high total cholesterol. We do have a high triglyceride, low HDL problem, so you'll see many people with hypertriglyceridemia and even more with low HDL. So about 70% of the population across urban and rural areas report low HDL. So this is the seminal figure from this paper, 101 million with diabetes, huge numbers across abdominal obesity reaching 350 million, huge numbers of burden in the country. So the lessons learned from this paper are that the prevalence of diabetes and all metabolic NCDs are high. Diabetes is in a stage of transition, with some states already at high prevalence levels, the ones with lower prevalence levels. So states like Kerala, Goa, Puducherry already in red there, those in the central part of the country waiting to convert now. So this gives us a window of opportunity to do aggressive prevention studies to bring down the burden of metabolic NCDs in the country. I have 40 seconds more, so I'm going to take a second to thank ICMR for believing in us. There are two DGs sitting here, both of whom were involved in this study. We could have never done it without you. A special thanks to Tanveer ma'am and Dhaliwal sir, who supported us through 15 years of this study. I dedicate this award to my late mother, who was my inspiration. None of this could have happened without a wonderful team and a supporting family. Thank you to everyone.
That was exemplary with time management. I am really requesting everybody else to make sure that you don't exceed 5 minutes, otherwise somebody will usher you out. Thank you.
And requesting now Dr. J.D. Pandian to kindly join in for his presentation.
Dr. Bhargav is here.
All right, all right. Finally, we are there in touch with Dr. Bhargav. Over to you, sir.
Good afternoon. Shall I start?
Yes, please, and you have exactly 5 minutes.
I'm Anurag Bhargav from the Department of Medicine at Biomedical College, and I was the principal investigator of the Rations trial, and on behalf of the entire Rations trial team, with my co-PIs, Dr. Madhavi Bhargav and Dr. Banu Rekha Velyotam, and the nearly 70-strong team on the ground, I thank the ICMR not only for supporting this study, and also for this great honor that has been bestowed on us. So, this trial was supported by the India TB Research Consortium.
Slides, please.
The Rations trial had collaborating institutions with the ICMR NIT involved, the Central TB Division, the Jharkhand State TB Cell, and local ethics oversight was by ECJUT. The rationale for this trial was clear that in India, the major driver of the TB epidemic and the annual TB incidence is the widely prevalent undernutrition in children as well as adults. And however, there was no evidence in the literature whether improving the nutritional status would reduce TB incidence. So that formed the basis of our intervention. The trial was conducted in Jharkhand in 28 tuberculosis units across 4 districts of Jharkhand, and started in May 2019 and ended in August 2022. We had 14, this was an open label field trial which was cluster randomized. And the trial population consisted basically of the household contacts of 2,800 patients with active TB, 1,400 in each arm. And their household contacts, there was a control arm where there were about 4,700 contacts, and the intervention arm with a slightly higher number of 5,600. The patients in both arms received a food basket, but in the household contacts, the intervention arm, in addition to the patient, the family contacts also received food baskets with multivitamins for 6 months. The primary objectives of the trial was to detect any difference in incident cases in household contacts over a 2-year period of follow-up. And there were many secondary objectives which I will not refer to in this presentation. The study intervention was based on the guidance document for nutritional care and support for TB patients in India. And this was evolved by a consultative process in a policy document. And of course, it is scalable also later through the public health system, public distribution system. So the patients bought a 10 kg food basket with rice, pulses, milk powder and oil, delivering about 1,200 calories and 52 gram proteins per day. And in the intervention arm, each family member got 5 kg rice and 1.5 kg pulses per day, per month, along with multivitamins, delivering about 750 calories and 23 grams protein, which was supposed to address their energy and protein deficit. This is just some snapshots from the field in terms of measurements. Coming to the main outcomes of the trial in terms of incident TB cases in contacts, we detected a total of 218 household contacts with incident TB, 96 in the in the intervention arm and 122 in the control arm. And we had follow-up time, so there were incidence rates also, 1270 per lakh person years versus 780 in the intervention arm. Now, we used generalized estimating equations and accounted for clustering and calculated the adjusted incidence rate ratio. For all forms of TB, this was 0.61, indicating a 39% reduction in incidence rate in the intervention arm compared to the control arm. But when we looked at the incident cases which were of lung TB, the infectious TB, there was the IIR was 0.52, indicating a 48% reduction in incidence rate. As a sensitivity analysis, we also performed Cox proportional hazards, and the adjusted hazard ratios were very similar. So we had 39 to 48% reduction in incidence rate in the intervention arm with this food-based intervention. And this is the Kaplan-Meier graph, again showing the same result. Fortunately, most of our patients with incident TB were microbiologically confirmed, more than 70%, and the others were clinically diagnosed, including there was this result was accompanied by weight gain in household contacts, actually in both arms, but it was higher in the intervention arm. The modest figures here also indicate that some of the patients' contacts lost weight over the follow-up period also during the COVID pandemic. So I just summarized the key learnings from the Rations trial, which is important as a potential public health intervention for TB prevention in India in communities with the burden of TB and undernutrition. And we found nearly 40 to 50% reduction following nutrition supplementation with this intervention, which approaches that of the efficacy of the M72 vaccine, which is about 50%. So according to our results, 30 households would need to be treated, given food support for 6 months to prevent one TB case. And this can actually complement other strategies for TB prevention like TPT. Also, of course, this nutrition supplementation reduces the prevalence of undernutrition by 28%. So I will just end by acknowledging the support of the ITRC and the Rations trial team and our departments and institutions. Thank you.
Thank you very much, sir. And requesting now Dr. J.D. Pandian to please join in for his presentation.
Good afternoon, everyone. So I'm going to present the results of Sprint India trial, which was funded by ICMR on behalf of Sprint India trial investigators. There is a high burden of stroke in India, and there are rates of recurrent strokes also very high from population-based studies as well as hospital-based studies. And we have a high prevalence of vascular risk factors in our country. And the research question is, can we use mobile health and as an intervention to prevent recurrent stroke? There are some small series available there. They have found that BP reduction and blood sugar reduction is achievable using ML. But whether it will reduce a recurrent stroke, it's uncertain. And we aim to reduce a recurrent stroke, acute coronary syndrome, and deaths in patients with subacute stroke with the help of SMS, video messages, and workbook. So we included patients over 18 years of age, first ever stroke, both ischemic and hemorrhagic stroke, between 2 days to 3 months of stroke symptom onset, and they should have a working personal mobile. And if the patient was aphasic or illiterate, a caregiver should be available with a mobile, and they will read those materials to them. In the intervention arm, we prepare the intervention package, text messages, videos, and workbook in 11 Indian languages through a formative research which took place over a period of 1 year, and there was acceptability and a good feasibility with the intervention material. And both the control arm received the standard of care, and in both the arms there was regular telephonic follow-ups in between while they received the text messages. The primary outcome is a composite endpoint of recurrent stroke, high-risk TIA, acute coronary syndrome, and death. And we had a variety of secondary outcome measures, including BP measurement, blood sugar, lipids, and physical activity, medication adherence, and modified ranking scale. The sample size was 5,830 for a 3% difference that we wanted to show. And the trial was conducted in INSTRUCT, Indian Stroke Clinical Trial Network. In phase 1, in first 5 years, there were 31 centers. And we screened about more than 5,600 patients, and about 4,200 patients were randomized, and 1-year follow-up was complete in more than 1,500 patients. The last 2 follow-up was less than 2%. We had a major problem with COVID. There was a decrease in recruitment during the COVID period. It built up, and by the time we reached 5 years, during the interim analysis, the DSMB said because of the less vascular events, it will be futile to continue. Plus, as policy of the task force project, it is funded for 5 years. So the results, you can see the baseline demography, stroke characteristics were balanced between both the groups. And this is a primary outcome, which was about close to 5% in both the groups. There was no difference. But in secondary outcome, there are 3 parameters, that is alcohol intake and smoking. There was a reduction, and the medication adherence improved in the intervention arm. And we also studied the process evaluation, fidelity, using a questionnaire. And this is, if you look at the uptake of the intervention, it's about moderate for text messages and videos. In the workbook, the median exercise that was done was about 9. And there was no contamination between the 2 groups. The stent, this is the largest HRCT designed, the idea from the Indian PI, funded by ICMR and executed in the field of neurology in our country. High quality trial and intervention package developed in about 12 languages, and fidelity assessment was done, and also the process evaluation was done. And limitation, low vascular event, maybe because the centers were high quality centers. The acknowledgement of text messages and videos was low. It was about 17%. And I think the major impact was of a pandemic, where even otherwise the incidence of stroke and heart attack lower during that time. And maybe if we had increased the number of years of follow-up to 2 or 3 years, we would have reached the end point. This was published in Lancet Global Health, and with a very good editorial. What it adds to the programs in India, prevention programs, probably if you're using behavioral intervention, using Hon'ble, we need to focus on videos. From the process evaluation, what we found was short videos would be more effective than text messages, because text messages, there is a fatigue that happens. After 6 weeks, they will block the number or they don't respond at all. So some valuable lessons can be taken up to our national programs like IHCI or diabetes prevention and NCD programs. And a conclusion, the semi-structured stroke prevention package does not reduce the risk of vascular events, but some certain lifestyle factors, there is improvement, including medication adherence, which has a long-term benefit. So I thank the INSTRUCT collaborators, ICMR's steering committee, and the DSMB members and all the site investigators and coordinators. I thank Dr. Katuch. I shared the initial idea of INSTRUCT when he was the DG, and through multiple other DGs with support, we were able to execute. And we thank Dr. Rajiv Bahl also for the continuous support. Thank you.
Thank you, sir. Up next, we have presentations from Best Paper, Intramural. And may we please request you, Dr. P. Manikam, to please take forth the session.
Good evening to everyone. Okay. So this study is about why there were sudden unexplained deaths among adults of the younger age group in India. Next slide, please. There were a lot of reports globally which are pointing to the fact that the sudden unexplained death could be due to COVID-19 or COVID-19 vaccination. However, in the Indian context, there were no reports, but then the media reports were attributing these deaths among apparently healthy adults to either COVID vaccine or COVID infection. There were concerns at several quarters, including at the highest level, that we need to look at this more critically. Therefore, next slide. We wish to study what are the factors that are associated with unexplained sudden deaths among apparently healthy individuals of this age group. Next. So we designed a study. Next slide. We designed a matched case control study. The designing was itself a challenge. We had to have 1,445 cases and 4,580 controls for the assumptions that we had. And we took approval from institutional human ethics committees. And then we could get 47 tertiary hospitals from across 19 states and union territories on board to make sure we have sufficient numbers to meet this study design and the study size. Next. We defined a case as an adult, an apparently healthy looking adult without any underlying cause, suddenly died within 24 hours of looking apparently healthy, maybe due to sudden cardiac reasons, maybe due to an unwitnessed death that happened outside within 24 hours of looking healthy, or after admission within 24 hours of hospitalization he or she died. And we took the deaths that were registered during October 2021 to March 2023. We excluded things that could have some explanation, and also for logistics and other reasons, we did not take cases which were from 100 kilometers beyond the study hospital site due to logistic reasons. Next slide. The controls were apparently healthy looking individuals of the same age group. They were matched for age plus or minus 5 of the same gender living in the same locality of that of the case, at least for 6 months before the death of the case. And we excluded controls who had had some known morbidity and that required long-term medications. Next. So this is the process by which we went through selection of, first to begin with listing of cases, and then selection of cases, and then collection of data, and also which included selecting controls in the neighborhood. Next, please. We ascertained the following exposures of interest. In terms of COVID, we took either record-based or recall-based or from data bases available at the national level, the vaccination history. We also took data
Dr.
from...
Manikam, you are going to exceed your time. So be very, very quick, please.
Okay. So we took information on COVID infection and also ascertained post-COVID conditions using standardized tools. We also ascertained the risk behaviors in terms of tobacco smoking, alcohol intake, including binge drinking, and recreational drug use, and vigorous, intense physical activity, which was usual and then unusual 48 hours before the death or interview as far as the case controls are concerned. We also took family history of sudden death. Next slide. So we analyzed the data.
Please go to the result. Please go to the result.
Next slide.
Final result, please. You have lost
Next
this
slide.
time.
So we did not find any difference with reference to some of the variables, specifically vaccine, but then risk factors where there is a difference. Next slide. So we could identify that, as you can see on the red line, indicates no association. On the left-hand side of the red line, you will see that vaccination was on the protective side. All the other risk factors except smoking were risk factors for sudden death. Therefore, next slide, we concluded, next slide please, we concluded that COVID vaccination was not associated with increased risk of unexplained sudden death among young adults. And the sudden unexplained deaths were explained by either family history of sudden death or hospitalization for COVID-19, and the 48 hours before death, binge drinking, and then vigorous intense physical activity. Therefore, we recommended, next slide, that we need not worry about being vaccinated for COVID-19 with reference to risk of sudden death among adults, young adults. The individuals may have to seek advice if they have had hospitalization for COVID-19 or they had had family history of sudden death. And any unaccustomed strenuous activity or exercise without medical advice have to be avoided, and any excessive alcohol drinking, especially binge drinking, has to be avoided. Next slide. So this paper was published in the IJMR, and I'm thankful to the ICMR and the entire set of hospitals and the collaborators who are part of Sudden Adult Death Study Group. Thank you.
I have a sincere request to everybody, please time yourself. Please don't take too much time on the methodology. You should know what to highlight and quickly go on and finish your presentation in 5 minutes. Otherwise, it will continue to drag. Please, next.
Thank you, sir. Can we please have next Dr. Abhijit Kadam?
This is so this particular ICMR SIA collaborating effort for adding arsenal against fight with COVID-19. So this was a trial done. Next slide, please. So the role of ICMR here was, it was a national coordinating site, ICMR Nari, now known as ICMR Nitwar. ICMR was the sponsor who budgeted for the trial site laboratory cost of RT-PCR by study sites. We were also the ICMR Nari was the central laboratory led by Dr. Madhuri Thakkar madam, where we did the CMI testing and and IgG testing. Execution of MTA for sample testing at Australia and USA was done by ICMR Nari. Site assessment, EC approval, development of SOPs, clinical trial agreements, hybrid mode SIV, monitoring, data analysis, and report preparation were done. I was the equally contributing first author for this particular paper. Next slide, please. So this was a multi-center trial. We had a bunch of stars from the actually already included arsenals, and so it was included. There were 20 clinical trials sites, 17 states sites from 7 states, 1 site from Union Territory, and 2 sites from the National Capital Region. Next slide, please. So this was the paper published in the Lancet Southeast Regional Asia. Next slide, please. So it was an observer. Yeah. Okay, great. Okay. So it was an immunobridging study. It was an observer blind randomized phase 2-3 in 1600 adults. In phase 2, 200 participants were randomized 3:1 to serum Covax, that is SI Covax or placebo. In phase 3, 1400 participants were randomized to 3:1 to serum Covax or the Novavax, 940 safety cohort and 460 immunobridging study. 2 doses were given at 3 weeks apart. Participants were followed up on day 22, 36, 85, 180 and with contact telephonically on day 120 for safety follow-up. Next slide, please. So primary objective was to assess the non-inferiority of the imported Novavax vaccine with the indigenously developed Covax vaccine by Serum Institute. The endpoint was to assess the ratio of the geometric mean titers to anti-SNG antibodies. There were secondary objectives which looked at the antibody levels at the day 179 and day 22. The safety was also one of the primary objective, and the AE and SAs was the endpoint assessments. Next slide, please. So this here actually the SI Novavax drug substance and Covax was produced, was the test vaccine, and Novavax was the comparator which was imported from the USA. There was restriction on the COVID-19 vaccine exports from the Western countries, and there was an urgent need to get another vaccine in the arsenal. Covaxin and Covishield were already there, but we need another vaccine. So this phase 2 study was initiated on 25th March 2021, and the randomization was completed on 2nd April, and thereafter immediately data was presented to DSMB, and the DSMB looked at the safety data at day 7, and it gave not for the initiation of phase 3 trial. Next slide, please. But there was a change in the national guidelines. We have to drop the protocol, drop the placebo arm from the phase 3 part as well, because Covishield and Covaxin was made available in the national program since 1st May 2021. So for the phase 2 part, the blind was broken on after day 85 visit, and compassionate use of study vaccine or program vaccine to participants who received placebo was given. They were continued to the study follow-up, and we had to resubmit the revised protocol to PIs, ICFs for regulatory SAC and EC approvals. All this process, we had to redo it again. Next slide, please. So the key findings was actually the adverse events in both the groups were equal. In the phase 2, there was no significant adverse events noted by the DSMB, hence it was given, go ahead was given. Next slide, please. Serum Covax and the anti-IgG antibody GMU ratio was 0.91 with lower bound of confidence interval of 0.79. So the lower bound margin non-inferiority was considered to at 0.67. So the lower bound here it was 0.79. So it was considered to be non-inferior and immunobridging.
Show us the last slide and stop.
Yes, sir.
So please, all of you, 5 minutes means 5 or 6 slides. You put 20, it will never finish in 5 minutes. Please go to the last slide. Please go to the final.
Yes, sir. Yes, sir. So
slide, please. आप इतनी स्लाइडें कैसे दिखाओगे? 5 मिनट में impossible है तो क्यों करने की कोशिश करते हो? 5 मिनट मतलब 5 मिनट.
Extremely sorry, sir. This was I would like to thank Dr. Nivedita Gupta for generating the COVID-generated vaccines certificates, which was a necessary thing at that point of time. Special thanks to Dr. Nivedita Gupta and her team, and thank you to Serum Institute trial site team, Dr. Samiran Panda, Dr. Seema Sai, Dr. Nivedita Gupta Madam, Dr. Manisha Ghate, Dr. Thakar Madam, Dr. Sheila Godbole, who was the original PI of this study, Honorable Dr. Balram Bhargav sir, and Dr. Rajiv Behel sir, and trial participants sir. Thank you, sir.
Thank you.
Extreme apologies.
Thank you. Next, please. All of you, please understand, you have such good studies. And if you don't communicate, you have 5 minutes means you should understand that I cannot show 15, 20 slides in 5 minutes. And please try to learn from, the 3 extramural presenters actually took exactly 5 minutes. So please learn that we also have to manage time and do not say too much. Thank you. Next.
Up next, we have Dr. Pooja Bhardwaj.
Thank you for giving me this opportunity. I am here to present our work on behalf of our team. So moving forward, scrub typhus, which is an acute febrile illness, is tropically neglected and re-emerging vector-borne disease. This over 1 billion of people are at risk of contracting this infection, and if this disease left untreated, it may lead to acute encephalitis syndrome, multiple organ dysfunction, and mortality rate as high as 30 to 70%. So this figure shows that the disease, which is earlier believed to be in the Shishikamashi triangle, has extended its region. And this is the map of India showing that except few states, almost all states have reported the incidences of scrub typhus. So the status of scrub typhus diagnosis in India is that we have the main 4 different techniques which we use for diagnosis, but all these deals with some of the demerits. Either they lack sensitivity and specificity, they need well-trained persons, or they need the well-infrastructured laboratory. But the molecular-based RDT is not available in India. Therefore, we aim to develop such nucleic acid-based RDT to promote early detection of Ornithia shishikamashi. So for this, we have adopted this strategy. The first thing that we have to focus while developing a molecular assay is to select the target gene. So we have screened number of genes, among which we have finalized the 56 KDA gene, which is the most sensitive gene identified for the Ornithia shishikamashi detection. And based on this gene, we have designed the primers for isothermal amplification, and this the target product that is amplified by RPA has been targeted to be detected by the CRISPR-Cas enzyme based on the guide RNA assistance, and the result the result of the CRISPR enzyme then can further be visualized through the lateral flow assay. So these are the results where we have designed number of primers, and among them we have selected the one with the best amplification, and based on that target product we have again designed the guide RNA that assists CRISPR-Cas enzyme to promote its cis and trans cleavage activity that further results in the dipstick assay detection. So these are the results. By the selection of that we have further optimized the concentrations of the various parameter of this assay, and then we have carried out the limit of detection, sensitivity and specificity assay with the clinical samples. So this assay that we have developed termed as LOCUS, that is lateral flow method based on CRISPR-Cas 12A isothermal detection for scrub typhus. This is the first report that we have used the Cas12A endonuclease system for the detection of Orantia osteochromatia, and this we have coupled the RPA, that is isothermal amplification, and Cas12A, which provided the triple specificity, that is first based on the specific primer, secondary the target that is amplified again recognized by the Cas12A enzyme, and based on that recognition only the transcleavage activity of the Cas12A activates. And with the 81 clinical samples, what we have found is the 97.6% sensitivity and 100% specificity, which is much superior than the earlier reported assays. So with this assay that we have developed, we expect that it will promote the early and rapid diagnosis of the disease, which will further enable clinicians to initiate prompt treatment of the disease, which will further reduce the case fatality and morbidity, then upliftment of the health status, strengthening of the public healthcare setting. The limitation of this study is that we haven't developed the instrument-free nucleic acid detection extraction.
1 minute.
And we have outsourced the lateral flow step, but now we have again the Intramural funded project, ICMR, and in near future we are going to have tackled with this, we are going to solve this problem also in near future. And in the last, I would like to acknowledge all the persons who have been directly or indirectly involved in the supporting this study. Thank you.
Yeah, very good.
Sir, time now allows us for a 15-minute open floor discussion, if we may want to have. We have a 15-minute discussion window now to be steered by you. If you'd like to have it here for the best papers presented till now.
Maybe I think since we are about 1.5 hours behind schedule because of the lunch and we didn't want to disturb the exhibition, let us do it together with the innovations.
Noted, sir. Absolutely. So up next, we have presentation of best innovations, and inviting now Dr. Dipankar Bandyopadhyay. By the time sir comes, I may just submit, see the beauty of Indian culture or tradition, that whatever be the dearth of timing, everybody wishes to acknowledge certain set of people. That talks about the magnitude also that we have for those who assist and guide us.
So much. So how to change the slides? So how to go back? So just to first thank you ICMR, and thank you all the organizers for inviting us here. IIT coming to a forum where ICMR is arranging this gala event, something which we thank DHR-ICMR for setting up this Center for Excellence at IIT Guwahati. So I'll not take much of your time. I'll just quickly go through our innovation, which perhaps many of you have seen, which is in the downstairs. It looks like a box like this. We call this as a magic box initially, and then now it has been converted into a mobile lab. You can see there are multiple components here. One centrifuge is there, one mixer is there, okay, one detector is there, and then there are incubators. So idea is that, say somebody, say in a PHC or CHC or some ASHA worker, right, they can really go to door and cater the healthcare needs to the rural population. We really wish that it goes to the last mile population, and my previous presenters were very much helping me in presenting this, because all of us want data, but then from where the data comes, right? So in IIT Guwahati, if you visit, why we could deliver this? Because we have a sensor hub there. We use materials, we use nanomaterials, we use different types of combinations of materials and physics in order to develop high fidelity sensors. And that's where, the success comes with some of the sensors. In this particular device, we have about 27 to 30 sensors, which are high fidelity sensors, which is giving us the accuracy. So it's a very portable device. Can you please run the video? There's a video here. It actually talks about how does it work. I hope the video works. You just click on the video. I think it is going to work. Just click on the video. It's going to work. Is it working for you? So you can see, how the venous blood is withdrawn, and then a paramedical worker can turn on the mobile phone, and from there can turn on the device, and then centrifuge, separate the serum, mix it with the reagent, and then they put it inside the incubator, then to the device. It's very simple, and you get the liver, kidney, lipid. I don't need to really tell anything about this in this particular forum, at least. Okay, so it's a digital solution. You collect data at the central place. Okay, and then this gives you the opportunity to really carry out the digital health program. You create the health database, electronic health record across the country. So we are pan-India. We have these are the places where we have already arrived. 120 units have been deployed. About 15 health camps conducted, 5,000 patients screened, right? So 50 plus proof of concept, 100 plus product demonstrations, and more importantly, Siemens auto analyzer, Johnson & Johnson, all this, the Make in India, main focus is the import substitution. So we are pretty much sure with this, we are ready to deliver maybe the first auto analyzer of the country. This is the trailer, the picture abhi baki hai. Okay, so that is going to happen. Okay. I just skip these slides. These are the acknowledgements, ICMR. Especially, I don't want to take any name. Everybody in ICMR, everybody in Ministry of Electronics. We want to thank everybody at IIT Guwahati. We want to thank everybody for this to make happen. Thank you so much.
Thank you, sir. Ms. Shilpa Malik, may we please invite you next? Dr. Itu Singh. Okay, we have on behalf of Ms. Shilpa Malik's project, sir, kindly introduce your name and please proceed.
Hello everyone, my name is Ram Dixit. I'm working with Bioscan Research as a sales manager Pan India, and I'm going to present on behalf of Shilpa ma'am. So first of all, thanks for giving us the opportunity to present innovative product on this platform. So Bioscan Research, it is an Ahmedabad-based company, and we are pioneer in spectroscopy devices, and presenting this Cerevo, which is an intracranial bleeding detector. Next slide, please. So this is small video which talks about our uses of this product, if can run. Next slide. Okay, maybe not. So this is a case of real case from Civil Hospital Ahmedabad. There is a patient called Ram Babu who came with the multiple fractures and totally conscious patients with the GCS score of 15. And doctors has decided not to send for the CT scan and send to trauma department. But my colleague was there for demonstration of this device, and he suggested the doctor that why not screen this patient for hemorrhage. And they screened this patient, and suddenly, next slide please. And because of this screening, they changed the line of treatment, and they decided not to send this trauma, send to CT scan first. So next slide please. So this is the result. Cerevo has detected 2 hemorrhages. Okay. So Cerebo has detected 2 hemorrhages in temporal and parietal side, and we confirmed with the CT scan, the report was the same. And 69 million patients, people are suffering from TBI, and 80% of them are mild or moderate. So 30% they have low recovery rate because of late detection. So to solve this problem, we have the 2 options right now, GCS and CT scans. Of course, they are gold standards, so, but they have their own limitations. Like GCS, it is a totally on subjective base, and sometimes it is an inaccurate 57% times, and of course it is a time consuming. When we talk about CT scans, of course it is a gold standard, but it has its own limitations, like it is a immobile, cost definitely, and it requires a particular infrastructures and expert to read this or make this report. But it is not like with this Cerebo. So Cerebo, it is a immobile, like a mobile and very handy device, and we are using this patented machine learning powered near infrared technology. So Cerebo can produce 3 kind of report. Immediately after screening, you will get this quick scan report, which is a color-coded report. So if there is a red, it means there is a hemorrhage. If there is a green, it means patient needs to observation for 24 hours. If it is a white or yellow, yellow means there is a warning. White means that you have not scanned properly particular lobe, or you missed one lobe. So this we are giving a 1 tablet along with this device. So you can get I2I or S2I report, which is nothing but it's a numerical and graphical presentation. You can share this report and print this report. And this is like a Cerebo, very objective based. It is not subjective based. So reports will not differ case to case. And it is a very fast, you can scan entire brain within 1 to 2 minutes. It is a very safe, because no harmful radiation. We are using non-ionized radiation, and it is a very easy, and because it's a handy and no calibration. So we have done many clinical trials with reputed institute like NIMHANS Bangalore, AIMS Bhopal, KGME Lucknow, and all clinical reports, they have been published with reputed journals. The outcome of these reports, sensitivity rate, Cerebo is presenting sensitivity rate 97%, and accuracy rate is 94%.
15 seconds.
Yeah. And these are reputed journals which we have publications for your reference. And we are
please
ISO,
come to the end, please.
Yeah.
Please come to the end.
Yeah, we are ISO 13485 certified company, and we have CEDESCO approval also. And Cerebo has got CMC certified. And for the disposable, which we are using on the front of that device, so we have biocompatibility test, so no cross-contamination.
Thank you. Thank you.
Thank you, sir. Dr. Itu Singh, the next 5 minutes are yours.
She was there. She was there.
Good afternoon, everyone. My study title is TrueNet Anupriya based on multiplex real-time PCR. Actually, it is a multiplex real-time PCR which is developed with the TrueNet for the diagnosis of leprosy. I am from Stanley Brownie Lab, the Leprosy Mission Trust, India. Next slide, please. Many people ask me today that leprosy is not here. It has been eliminated, but I want to mention that still we are contributing around 59% of cases to the world population of leprosy. Next slide, please. So there are many problems with the diagnosis of the leprosy. There are no gold standard method available for the diagnosis of leprosy. Many things are available, like experienced clinician can diagnose with the available cardinal signs and symptoms. AFB staining can be done, histopathological picture can be done, serological tests are available, molecular tests are available. But the sensitivity and specificity is low. So diagnosis should be early enough to so that treatment can be done early to prevent the disability and transmission in the community. And this early diagnosis will help us to achieve zero leprosy target also. Next slide, please. So the innovation part is that SBL developed mLEPRI specific multiplex PCR by using 3 specific genes of mLEPRI, and we can diagnose 100% of MB cases and 93.3% of PB cases with 100% sensitivity and specificity in MB cases and 100% sensitivity and 93.3% sensitivity in PB cases. This was funded by ICMR in 2014. Next slide, please. So this picture shows the individual gene sensitivity and multiplex PCR sensitivity. Next slide, please. So we developed, why we choose TrueNet? Because TrueNet is WHO endorsed platform and it is Indian, and it is available in most of the labs and hospitals in the India. Next slide, please. This is the workflow of TrueNet. Next slide. And it has been developed as the field-friendly diagnostic tool for diagnosis of leprosy, and the test has manufacturing license from the CDSCO. Next slide. So clinical validation has been done and it is within the approved limit. CI was less than 15%. Next slide, please. Next slide. So this is the positive 88% positivity we observed in PB cases and 100% positivity we observed in MB cases. Hence the sensitivity was 0.88% in 0.88 in PB cases and 1 in MB cases, and specificity was 1 for TrueNet. Next slide. This is the screen how we can see the result of the TrueNet. Next slide. So we detected we screened household contacts of the leprosy cases also, and we detected 45% of MB cases as the positive TrueNet by the positive by TrueNet test, and 31% by in the PB contact cases, and 9 cases has been developed disease after 3 years, and 1 case from the negative group has been developed the disease, and 1 from PB case. Next slide, please. So this is the when the household contact developed the disease timeline. 30 seconds. Next slide. Next slide. This is the family picture. Next slide. Next slide. Next slide. So clinical application of TrueNet mLEPRI assay is advantage of increased sensitivity to diagnose early cases of leprosy, which are PB and difficult to diagnose cases. The test can guide clinicians to suspect subclinical infection so that we can keep them in the high risk group. This is the point of care test. Contact can be tested for subclinical infection, and result can be obtained in 1 hour.
You have to come to the end.
Sir, this is the last slide, and will curb the transmission, reduce disability, and minimize discrimination. Next slide. Next slide. Thank you to ICMR and my host organization. Thank you, sir.
Thank you.
Thank you, sir.
We now have presentations from Best Intramural Innovations, and presenting up next we have Dr. Manisha Madhaikar. And meanwhile, The green button on the control takes you forward to the PPT presentation, and the red button takes you backward. It might make it easy for the presenters to use this. Thank you.
So, good afternoon, everybody. At the outset, sincere thanks to ICMR for this honor. I'm actually representing my team here. My inventors, Dr. Smt Shetty and Priyanka Kasetkar, and Department of Hemostasis and Thrombosis, who have actually worked very hard to get this kit in the market. So what is hemophilia and what is von Willebrand disease? Both of them are bleeding disorders. Hemophilia results from deficiency of factor VIII, and it can result in joint bleeding, muscle bleed, post-traumatic bleeds, and if it remains undiagnosed, can cause severe morbidity and mortality. Von Willebrand disease, again, is an autosomal disease, either autosomal recessive or dominant. Severe form results in mucosal bleeds, menorrhagia, postpartum hemorrhage, especially very important in women, as nearly 10 to 15% of patients with menorrhagia and postpartum hemorrhage can have this disorder. And its incidence is supposed to be 1% in the population, but majority of them remain undiagnosed. Currently, we have very complicated assays which require sophisticated equipments, costly reagents, and both factor VIII and von Willebrand disease require, the cost comes to nearly 2,000 to 6,000, depending on where you are doing the test. In India, it is estimated that we have nearly 140,000 severe hemophilia patients. Only 27,000 are currently registered with Hemophilia Federation of India. And von Willebrand disease, which is the commonest bleeding disorders, only 800 patients have been diagnosed till then. What is good is we have treatment available for hemophilia. We have nearly 300 hemophilia treatment centers or HTCs which give factor treatment, and unfortunately only 13 of them have availability for factor VIII level measurements, and only 5 of them can do von Willebrand disease diagnosis. Identifying both of them and differentiating is important for giving them specific treatment. And that is the reason why our scientists, Dr. Srimati Shetty and Dr. Priyanka Kasetkar, who was her postdoc student, decided to take up this challenge of developing a point-of-care test based on direct lateral flow immunoassay. Actually, it needs a lot of standardization in terms of selection of right antibodies, right membranes, and then gold nanoparticles. And after standardization, actually, we did a series of testing to check their stability, then different sample types that we can use, different settings where we can perform the test, and inter-observer agreement as well as internal and external validation. Then the kit was given for ICMR for transfer. And Bud Biotech has taken up this kit. They again did an external validation with well-reputed labs in India. And finally, the kit was marketed with CDSCO approval. It has a detection limit of more than 5% for both factor VIII and von Willebrand disease. It is kept at that to pick up all severe and moderate hemophilia as well as von Willebrand disease cases, and the cost is only 200 and 250 rupees respectively. This has been launched by none other than our Honorable Health Minister in August 23. So this kit actually requires a very small sample volume, as it is a point-of-care test. It is low cost, good reproducibility, no requirement for a technical manpower or expensive reagents, and it takes only 15 minutes for diagnosis. This is the kit can be used at all the emergency departments, obstetrics and gynecology, and hemophilia chapters and hemophilia treatment centers for early diagnosis and appropriate treatment. World Federation of Hemophilia has also recognized its potential and requested the company to take this product to Africa. So I think with this, I think the credit goes to our inventors who have taken pains to standardize. Team from ICMR, a team from Hemostasis Department, Dr. Rucha and Bipin, who have taken efforts to validate and take this ahead. All our external validators who have validated these kits, and of course support from ICMR, DG-ICMR, the ITR division and BMS division, and everybody who has helped for this kit. Thank you so much.
Thank you, madam. Up next, we have Dr. Shyam Sundar Nandi, the only one with a bounteous of choice because he's got 2 innovations to present.
So he has 10 minutes.
Sir, if I may say that.
Good evening to all of you. I am going to present my invention, that is development of a calorimetric isothermal assay for detection of monkeypox. You have seen the present scenario of many countries. So in India, there are 2 cases now, and we are in the still preparedness phase. So this is the picture of different symptoms of monkeypox. So we have developed this LAMP assay for detection of monkeypox, and then we have done the validation and performance evaluation. We have also included this technology in the kit now. We have invented one syringe filter where you can directly extract the nucleic acid without any instrument. And then we have patented it also. So all of you know the LAMP assay. We need the isothermal amplification here. And in presence of BST2 polymerase, there are 6 primers, and it usually takes 40 minutes. And you can see the results by your own eye. So in this technology, we have targeted 4 different genes. And during the positive amplification, there are proton released, and it's a pH-dependent color change. And you will get the color change within 30 minutes. And while a negative amplification, there are no proton released and no pH-dependent color change. We found 100% sensitivity and 100% specificity. During the validation, we have tested different heterologous samples. This is the results. And finally, results showed that the B6R4 primer set is genus-specific, orthopox virus, and also F3L4 primer set is monkeypox virus-specific. It's not changing. Yeah. So this is the final slide for interpretation of the result. First one is the NTC. There is no color change. Then sample A is the positive for orthopox virus and negative for positive for orthopox and monkeypox both. Sample B is positive for orthopox and negative for monkeypox. Sample C negative for orthopox and monkeypox both. And if you get the sample D kind of result, then it is inconclusive, and we have to repeat the test. We have submitted the patent application recently. I am also thankful to Dr. Pragya Madam and Dr. Ronita Madam, who has supported to development of this assay. All the validation has been done by BSL4 group at NIV Pune. This is the validation report from our institute only, because there are no other sample in any laboratory. So BSL4 group has developed, BSL4 group have done the validation. That time Dr. Godbole Ma'am was the director in charge at NIV. And now it's under technology transfer process from ICMR. So the unique selling point of this assay, all the primers are new and novel for RT LAMP assay and designed in-house. The assay can be performed using a simple temperature heating device, 65 degree plus minus 1 degree. The time required is only 40 minutes. The results can be interpreted visually. No other sophisticated instruments are required for interpretation of the results. No highly skilled technical person is required. The assay could be enabled field testing outside the diagnostic laboratory. So in conclusion, LAMP assay is novel, gene-specific amplification, good molecular specific, highly sensitive, specific, and efficient. Considering this scenario, we have developed this assay. The assay targeted two genes, B6R4, which is genus specific, and F3L4, which is species specific. Other viruses belonging to genus Orthoporus can be also be tested with this LAMP assay. We found 100% sensitivity and 100% specificity in comparison to real-time PCR. So I acknowledge our DG sir, also previous DG sir also, he was that time we initiated the work, and we have got lots of support from Nivedita ma'am always to do this validation. I also acknowledge Dr. Deshpande's contribution because he guided us every time, and Dr. Shailesh Pawar and my wife and my daughter also. Thank you so much. My next presentation, please. Yeah. So, sir, in this, basically we have developed a polio non-permissive cell line where you can grow the polio without fear of any inadvertent growth. So, after post-polio eradication, country need a cell line where polio will not grow, but all the other enterovirus can grow. So we have used the CRISPR-Cas9 technology to develop this cell line, and this cell line will help to the entire world to keep polio free. After this development, we have submitted this cell line to ATCC USA. Now it's available with ATCC, anybody can buy from there. And last year I presented this that cell line in WHO headquarters, Geneva. They invited me for present my work there, and now we are distributing this cell line to many places now. So you know that CRISPR is a very beautiful technology for genome editing. You can delete any bad gene or you can include any good gene. We have used the same technology. You know, these two scientists awarded Nobel for CRISPR. So I'm not going to the mechanism of action of CRISPR. So as per the Global Action Plan 3 and 4, after the type-specific eradication and containment of wild polio virus and cessation of oral polio vaccination, minimizing the risks of poliovirus reintroduction is critical. To prevent the reintroduction, the number of international poliovirus facilities will need to be reduced and to the minimum necessary to perform the critical functions of vaccine production, diagnosis, and research also. So all of you know that RD cells are very highly sensitive to polio, coccidiovirus, ecoviruses, and number of enteroviruses. RD cells are used for combination with L20B for poliovirus diagnostic as per WHO norms. The cells are widely used for enterovirus surveillance, diagnosis, and research. So we have those who are working on different enterovirus laboratories. They need a non-polio polio non-permissive cell line. That's why you have developed this cell line. So the rationale was to avoid the poliovirus in polio permissive cells. If we knock out the CD155 poliovirus receptor from cell surface or dysfunction it, the same cells would be rendered poliovirus non-permissive without affecting the sensitivity to the other enteroviruses and non-polio enteric viruses, because no other viruses use the CD155 as a poliovirus receptor. To support the poliovirus containment, we have developed this cell line. This was the objective of our study. So you can see the picture, poliovirus red and blue, and it's bound to CD155 purple. There are three domains, D1, D2, and D3, and D1 is recognized by the virus. During the CRISPR experiment, it takes almost 3 to 4 months to do all this experiment. I'm not going to details. And sir, after this experiment, we did the clonal selection. You can see these 9 clones after the CRISPR-Cas9 experiment. And you can see the RD, SJ35 and 40. There are, when we did the sequencing, targeted sequencing, we got 19 nucleotide deletion in exon 2 and 1 nucleotide insertion. In exon 3, 99 nucleotide deletion, and there is no inclusion or deletion in exon 4. Similar kind of 41 nucleotide deletion in exon 2, 99 nucleotide deletion in exon 3, and no inclusion or deletion in RDSJ40. Then we have checked this cell line with different enteroviruses. and we got the correct result. Then we sent this cell line, then we did the confocal microscopy. You can see the fluorescence that above the cell surface, CD155 expressing in RD cells, but in the knockout cell line 35 and 40, there is no
1 minute
expression of CD155. Then we sent this cell line to 3 national laboratories. They did the validation on 626 samples. We found the correct result from 3 labs. Then in collaboration with IIT Mumbai, we have done lots of structural analysis. These are the results. And then we deposited the cell line to ATCC USA. So the application of the cell line, the CD15 poliovirus knockout cells RD can be used.
30 seconds left.
Newly developed cell line can be used to clean up any suspected old poliovirus contaminated samples. And after this development, we received one that time appreciation letter from former DG sir also. Then we published this in Journal of
You can
Medical
show your
Virology.
letters later.
And
thank you very much.
This is the patent
Thank
status.
you.
We have submitted in India.
Very
US,
good,
and
very
global.
good. Thank you. You have finished your bounty of time as well. Thank you. So should we have a brief 10 minutes, 15 minutes you said? Yeah, but at this point we can do a little break in monotony. We don't want people to get bored with just one after the other. Just to say a few words and then maybe ask you people if anybody would like to comment. I think we heard 6 wonderful papers, research papers presented, ranging from the role of nutrition in reducing the risk of TB, which was super fantastic. I think it will have great impact on the program as we go along. The India B study, which was such a large and well-conducted study, a survey all across the country, giving us such good insights about not only that these NCDs are a problem in the urban areas, but also in most of rural India. And the pre-diabetes was particularly striking, that wherever we don't have diabetes, we still have a looming epidemic because there is pre-diabetes. I thought the stroke prevention was super again, because not only it is the result that you get, but the fact that you have a wonderful platform and the quality with which the studies were done were all wonderful. Similarly, the intramural sudden deaths, it was such a big issue and it was such a big headache for not only the government but people at large, that are people dying of vaccine related. And we thought, and when we conducted this study, we found actually vaccine reduced the risk by 50% of these post-COVID deaths. It was actually other risk factors that Dr. Manikam mentioned. And it was, I think, not only that this study was done excellently well, you all did it in record time. For me, that was the key, because if we are not topical, we are not really helping. And if we are not contemporary, we are not helping. I think the Covovax studies really added to the armamentarium of the country that we had for vaccination. So again, was done with very, very good quality. And the scrub typhus, I think Gorakhpur has been well known for dealing with and actually helping in controlling all the acute encephalitis syndrome. And I think scrub typhus deserves much more attention than it has from all the medical community. And I think this test that you have developed will go a long way. Similarly, the Mobi lab for me, and it's a dream come true. When Dr. Paul asked me about a year and a half ago, can you get all these NCDs at Ayushman Arogya Mandirs? I challenged the teams in IITs and my colleagues in MDMS that can we get this? You people have actually got it done. So again, wonderful work. Cerebro, I think it is something which should be really appreciated, given that we have now a device which is a fraction of a cost of setting up a CT, and it gives you such good information about intracranial bleeds both extradural and subdural. So this will really go a long way again in terms of not only traumatic brain injuries, sports injuries, things that happen where you don't know what to do with the patients and who to get CT and not to get CT. The cost is almost negligible if you are doing this. TrueNat, extending to leprosy, extremely good. I think the hemophilia test, point of care, shows us how much money can we save by if you are talking about patients getting tested at 4,000 to 6,000 rupees versus 250. That is a huge saving for the country. And I think it is also, as you said, first in the world. So again, my congratulations. The LAMP assay for Mpox and is again a landmark that we should be able to get cheaper diagnostics. We just saw in the exhibition a LAMP assay for TB being now very, very close to being commercialized, and I think, or being at least validated. So it would be, these would help change the situation on the ground in terms of diagnostics. I think the polio virus has been a problem, and any technology that can help us in future stopping the spread of polio by inadvertently growing it, etc., is wonderful. And it has been, as Dr. Nandi was saying, greatly appreciated by not only within India, but internationally. So I see all these, but I want to mention, these are not work done over years. May have been the work done over years, but we have only taken 2023 very, very strictly. Any paper published between 1st January 23 and end of 31st December 23, or innovation that was either patented or licensed or what, or completed within this year has been taken. So next year it will be the 2024. So it is just 1 year, and it is just what has been supported by ICMR. And we are not talking about India and healthcare. We are talking about what has been supported by our intramural or extramural research program. So having said that, maybe 2 or 3 thoughts, comments that you may have on these 12 presentations. I will start with Dr. Katoch while people can be given microphones if 3-4 people want to make short presentations. Dr. Katoch.
The Secretary in DHR has already, I think, summed up all of them very well, you know. Now the next step which people must be thinking and where to go actually from here. See, for example, all the tests, how fast they go into the translation, you know, that means they reach out to the people. So the studies for feasibility of them to be introduced in the public health system actually. That's the, I think, should be the challenge by the investigators. They should not leave as the stage of development. But one more challenge, you know, which always remains a tunnel one, the diabetes story, is rising. And every year we talk the same, give us something to be done. And we talk in very non-specific language. I think that's something you should think in very specific terms. What to be done actually? And are you making a difference? I have not seen BM making a difference in the last 20 years at least, you know. So I think you start thinking to make a difference. I think that's my only comment, yes.
Thank you. And if other than speakers also would like to make a comment, please, I would like to see other very distinguished guests are here. If you would like to make any comments. Dr. Pandian, though, go ahead, please. बाकी कोई अगर हैं तो उनको माइक्रोफोन दे दीजिए. Yeah. Anybody wants to say?
I'll be very brief. I'm really impressed with the Cerebro. They are showed in TBI. Currently, we have 2 major projects. One is a mobile stroke unit in Tezpur and Dibrugarh. We could validate there. You know, you have a CT scan in the ambulance, and you use this device and see whether it's, how is it correlating. Plus, in the Instruct Phase 2, we have 4 trials ongoing, and 2 trials are acute stroke trials within 4.5 hours. One in hemorrhage, one in ischemic stroke. So probably this is one area we could validate and expand
No, thank
the
you.
work. Yeah.
But just to say that this is on GEM, this is validated, approved, it is actually available, you can buy it.
Yeah.
On GEM, it is for 17 lakh rupees, but yes, I don't think they have tried it in stroke, hemorrhagic stroke.
Yeah.
So that would be another way of doing it. Thank you very much for your
Yeah,
thought.
because there is no biomarker to
Yes.
differentiate. So
I
if we
agree.
have something simple, yeah.
So because we just do, for hemorrhage, we do CT scan. So if we can, I agree with you that in ongoing studies we can do that. Yes, if there are any other.
Yes, sir. Good evening. Good evening, sir. So my question is to Dr. Manikam's study. I just want to, out of curiosity, just want to know that what is the percentage of Covaxin and Covishield? Have you categorized in your protection study or
Yeah,
how many?
thank you. Your question is clear. Please.
It was majorly Covishield. Thank you.
About more than 90% of cases and controls had received Covishield in these areas. So there were some obviously cases of patients or cases and controls both who had received Covaxin. What was the percentage? Do you remember?
More than 90% it was Covishield.
Yeah. So that was the national figure as well. Thank you. Anybody else has any thought, comment, or question? Yes, please introduce yourself also, all of you.
Yeah, myself, Dr. Anandip Chaudhary. I work as a scientist in Society for Applied Studies. Just a comment, sir, based on specifically that that metabolic syndrome prevalence study. As Dr. Kottaj also mentioned, we know these things are going on for last 2 decades. And if I see the prevalence, sometimes it is 15%, sometimes it is 17%, but sometimes it is 20%. But what to do? And I think this is a suggestion to you, sir, that maybe ICMR and DHR may think through to develop some consortium where we can think through what are the potential solution only not for the adults. Because we all know the basic biology of this condition. It starts from birth, even starts from pregnancy also. So how we can develop a preventive strategy and thereafter a management strategy as a consortium. Thank you.
Very good idea. Very good idea. Yes, thank you. Anybody else wants to make any suggestions before we continue with the rest of the presentations? We have some flash presentations, I guess, from PhD students and then some best team presentations. Thank you. Please go ahead. I don't see any other, unless I'm missing. Nobody is standing up. Let's continue so we finish relatively early. Thank you. People have been here for long.
Absolutely.
So
Noted.
let's not keep them more.
So perhaps this is going to be faster than the light because it's a flash presentation of a minute. And inviting now Dr. Sharmi Naha to please make the presentation. And Ms. Oishika Das to kindly be ready with the presentation following Dr. Sharmi's presentation.
If those of you who have been called come to the sofas here, come to the front row, sit here, otherwise we save half a minute. Aage बैठो.
Good afternoon, everyone. The title of my paper is Carriage and Within-Host Diversity of MCR 1.1 Harboring E. coli in Pregnant Mothers and Intramother Transmission Dynamics of MCR. MCR, as we know, is the colistin resistance gene and is present in plasmid. So we try to understand the carriage of this gene in maternal and neonate. Also, we try to understand the transmission dynamics of these genes and transmission of these genes from mother to neonate. In order to do so, we found that the mothers were carrying MCR gene in their gut while the neonates does not have this gene. And this MCR gene, the only variant of MCR gene was MCR 1.1 in our study, and it was found in E. coli only. To understand the transmission dynamics of these genes among the pregnant mother, we carried out certain experiments like pulse field gel electrophoresis to understand the diversity of the strains, and then we did whole genome sequencing and compared the plasmid sequences, and we found that the plasmid sequences were completely similar to each other. So next we tried to understand the genetic environment and found that the genetic environment was pretty conserved in all the strains. Okay.
Yeah, it is flash. You have to flash.
Okay.
Yes.
Thank you.
Just show the final result if you have any.
Oh, that is
Just say
this
conclude.
one is the final result actually.
Conclude.
Okay. So we found that within-host diversity among the pregnant mothers, and the transmission of MCR was chiefly due to plasmid, and inter-mother and intra-mother transmission of MCR was also noted. I would like to thank my guide, Dr. Shulagna Basu, ICMR and ICMR Nirbi. Thank you.
Thank you. You can leave that slide. We can read that. Thank you. Well done.
Thank you. And up next, we have Ms. Oishika Das.
Okay, so since it's a flash presentation, I will try to keep it short. So this is my thesis-related work where I mainly focus on RNA-binding protein AUF1 because majority of this protein is available in gut and spleen. So we have selected butyrate, which is a well-known short-chain fatty acid that has been derived from the anaerobic fermentation of gut bacteria. We have studied independently in human tissue organoids from colon biopsy sample, experimental mice model, and knockdown model. So the major finding of my study that we are the first one that developed the knockdown mice by using morpholino oligo in case of the non-availability of knockout mice. And also we suggested how butyrate, the short-chain fatty acid, acts through AUF1 to regulate cholesterol, and also it prevents the enteric pathogen invasion by quenching the membrane cholesterol and gut barrier function. And next slide, please. These are some of my publications during my thesis-related work. So thank you, my guide and director. Thank you.
And up next, we have presentation by the best team to begin with Innovations for Anemia Mukt Bharat team. The presenter to kindly step forward, followed by the monkeypox diagnostics vaccines team and the iDrone team to follow.
Thank you, sir, for awarding us with this award. Can we have the slides?
Next slide.
It's not coming up. So my time starts now, maybe. So everyone is aware of the prevalence of anemia, I'm sure. So I should not be telling more about it, that it's highly prevalent, and we have anemia in not only in children, but also in women and men. So what is the problem? We have Anemia Mukt Bharat also here, and we also have screen and treat strategy. So what is happening in the villages or at the ground level is we have some kind of diagnostic barriers. So when we talk to the innovators developing this technology, they told us that there is a problem of calibrating the device which is currently available. These devices generally get lost when they are used by the ASHA workers. That is again one problem. And once the treatment is given, there is no mechanism to then monitor how it is going ahead. And we also need to have some kind of a dashboard to appropriately monitor how is it going. So these are the key challenges, and therefore there was a need to develop a point of care technology which can easily do screening, we can do the treatment, and we can also keep a track on how it is going on. So since this is an award for best teams, it becomes very, very important to understand how different teams contributed in development, validation of this device, and this is now a regulatory compliant device. The journey of this device development started in 2021 when the ICMR DHR Center of Excellence was set up at IITs. This is a product which came out, the POCT device, it came out from IIT Kharagpur. We went to the center and we saw different kind of products being developed. We apprised them that these are the different kind of things government is looking for and these are the NHMs wherein you should look at and try to develop products. We could find one product which could align with the Anemia Mukt Bharat strategy. But when you look at the device was very, very box kind of a device. It was very crude, and when we did ourselves, we did that test on this device. It took a lot of time to come out with the results, and results were also not very accurate. So this was the alpha prototype which was demonstrated to us when we visited IIT Kharagpur with this team. And when we also demonstrated this product in G20 summit, Dr. Paul would say that we definitely need a point-of-care device. That was well communicated to the team. The second version of the device was brought to ICMR headquarters, and our DG himself took a test on this device. It was still not very accurate. That feedback was given to the team, and again, guidance by Dr. Paul was very consistent since it's very, very close to his heart. Then came the device which is demonstrated today below in the exhibition hall. This is a strip-based assay. One single drop of blood you have to put on that strip. You just do not need any hematometer. You do not need any device for doing this test. You just need a cell phone. So every ASHA worker has a cell phone. You just need to scan that blood spot. It's a device-free product, and then it also has a dashboard attached to it, so there's no problem of data being put into the device on cloud. AI/ML integration is well into this device, and this was then regulatory strategy streamlining was provided to this to MedTech Mitra. We demonstrated this device to the regulators. Then NABL accredited lab tested this device. Manufacturing license was received. Clinical study protocol was developed by RCN division of ICMR with CSTU. Here we are there at Safdarjung Hospital trying to monitor how the validation is happening. Validation is also now complete. We are now at this point in time analyzing the results of the validation study. So we present here the final solution, HemoQR, which is a strip-based assay. As I mentioned, it is very, very good for screen and treat strategy, wherein you do not need any kind of a device, you just need a cell phone. 3-step process, anytime, anywhere. It just takes 30 seconds to do the test. It is rupees 50 per test. You just need a strip. It's disposable completely, and you need the phone. You just put that blood spot, scan the strip, get the results within 60 seconds. So this is the minimally invasive device which we took to Safdarjung Hospital, and they said it will be really good if we can have something non-invasive device. So with this help, they have now developed, with this guidance, they have now developed another version of non-invasive hemoglobinometer. So here comes our team. You would have seen in the journey that it's a very complex multidisciplinary team which joined hands with each other. We have engineering team, we have a medical team with the help of which this startup company SmartQR, which is sitting here, could develop this technology. Then we had a startup company to take it forward. We had validation centers, we had ICMR team, and the ICMR MDMS was throughout under the Division of Development Research. And
Thank you.
We would like to thank each of our teams.
वो टीम का लगा दो भाई, इनकी स्लाइड लगा दो. जब तक ये जा रही हैं तब तक दूसरा आ रहे हैं, नहीं तो एक्नॉलेजमेंट नहीं हो पाएगी.
क्योंकि सर एक्नॉलेजमेंट भी बड़ी हमारी स्ट्रैटेजिक है. This is the team MDMS under Division of Development Research. Dr. Taruna Madani is very much here guiding us. IIT Kharagpur engineering team. Then we have the SmartQR team, industry team, our ICMR team, and then we validation team. So that's how we got this award. Thank you very much.
Thank you, thank you, thank you.
Up next, we have the monkeypox diagnostics and vaccines team rep.
Thank you very much to all the esteemed people sitting on the dais and all the esteemed people in this room. So I'll be quickly presenting what we have done on monkeypox R&D. And this all this work started after July 2022, when monkeypox was declared as a public health emergency of international concern. So it was done in a very short time frame. And I'll briefly be telling you who has done what. So we at ICMR headquarters were involved in conceptualization of entire landscape of monkeypox research. We were involved in diagnostic capacity enhancement, protocol writing, establishing collaborations with different partners, involving VRDLs in monkeypox testing, and developing diagnostic validation protocols because we were receiving lot of requests for kit validations. We wanted to establish surveillance for monkeypox in various states. So we reached out to multiple state governments and we were daily coordinating and following up with the VRDLs and all the states. And we were also identifying suitable institutions and nodal people to undertake each allocated component and bring together everyone, and also were troubleshooting on a daily basis. We were guided by an esteemed expert group set up at ICMR. And then the roles and responsibilities, ICMR NIV played an exemplary role in all the work which was done on monkeypox. They quickly developed an indigenous diagnostic assay for monkeypox, distributed it to 35 VRDLs. They also provided support to SEER member countries by giving them test kits. They provided SOPs. They also did a very specific research study to find out that whether smallpox, people who were vaccinated by smallpox vaccine, are they protected against monkeypox? So this was a lab neutralization study which was done very quickly. They isolated the virus and recently given it to THSTI also for vaccine development. They developed an IgM and IgG ELISA, conducted studies on viral kinetics and immunological response related to monkeypox. They also did sequencing, whole genome sequencing, and could detect clade 2, and very recently the very unique and rare clade 1 was also detected and reported by NIV in India for the first time. So all this work was done by NIV Pune, and we at ICMR headquarters supported them wherever they required support. Then ICMR Nitwar also conducted a very unique study along with ICMR support from ICMR headquarters and ICMR NIV. We wanted to see whether we really have transmission of monkeypox in India, what is the seroprevalence of monkeypox in high-risk population, whether we do see symptomatic cases of monkeypox. So we established a sentinel surveillance network in high-risk populations with the help of community-based organizations. And we actually screened more than 3,300 participants in a very short time frame of 6 to 8 months. And we could just see a seropositivity. So in all these 3,300 patients screened, we could not find any monkeypox positivity in any of these symptomatic cases. Further, we did a sero survey in this population and we could only find 0.8% positivity for monkeypox. So we concluded that currently this disease is not a cause of concern and we don't see an evidence of active transmission of monkeypox in high-risk populations in India. These are the 35 VRDLs which were immediately looped in, and we could establish a pan-India testing network for monkeypox across India. And this was steered by ICMR headquarters along with NIV. And this is several other CBOs who were brought into picture to gain access to the communities and sensitize them. There were some supporting institutions also. In a short time span, we could achieve outcome of establishing diagnosis at 35 VRDLs, sequencing and reporting clade 1B and clade 2, indigenous testing methods for non-monkeypox viruses like buffalo pox, etc. Then standard protocol for molecular diagnostic validation. 3 kits were approved and available on GEM. ELISAs were developed. We could do sero surveys. We could see cross protection with smallpox. And we also have shared the virus. 10 publications came out in this short span of time. And just I wanted to name everybody who's involved, so would not be reading the names, but just putting them so that everybody could see. These were the teams from various institutes, CBOs, and VRDLs.
Okay. Thank you.
Thank you.
Thank you, Chief.
Thank you. And for the final presentation, may we have the iDrone team.
Okay. Good afternoon. So thank you for giving us this award. So I will start as we say iDrone. So iDrone was actually an acronym, not just drone. It was developed for drone response and outreach in Northeast. And we started this activity of my knowledge of Shadiwala drone to what we are doing today. So we thought of this thing when India was facing COVID-19, and we thought whatever vaccine we will develop, so we will deliver this thing through drones. So this is how we started journey. But here, when we talk about drone, it is not just putting thing into the drone and flying it to the other place. But here, basically, the flying part is the least where we think. There are many other factors where we thought how to do it, what to do it. So whatever studies we are doing, so we are doing acceptability, adaptability, practicality, integration, and finally implementation. So we started this activity, we validated in IIT Kanpur how to do it, and when we went to Manipur and Nagaland to basically deliver vaccine through a drone, and we did it not just for one place, but we did it from land to island, land to hill, hill to hill, hill to island. So whatever permutation and combination was there, we did it. And we did almost 20,000 medical supplies there, and lot of uploaded we got. This was documented in documentary with Honorable Prime Minister, with Bill Gates and many other people. So release of guidelines was also happened, and we thought, okay, this is done. We were given a task and we completed. Then DG sir joined, and DG sir said, this is not just end of it. Picture abhi baki hai mere dost. And then we developed this utility framework with DG sir. And here we categorize actually everything in 4 parts: minimizing the referral attrition, remote healthcare services delivery, centralized supply, and reducing the time for action. So where we find out many other examples where we can do. And with the consultation of sir, so sir has given a task. Sir said, okay, you have done in Northeast, now you do it in -10 degree and 15,000 feet, and you do delivery of vaccine medical supplies and also do the feasibility study. So we did it in Keelong, Lahore and Spiti, actually where we felt many of the technical difficulties. Then this was completed. Sir said, okay, now I will increase one more level of difficulty. So sir said, there is institute in Manipal. So they have secondary care hospital there, they have all the facilities, but they don't have the frozen section. So we need a facility where we can transfer sample during the surgery to the higher center, and through frozen section we can communicate result to the secondary care. So then under the guidance of sir, we did it. We completed. Till now 30 surgeries has been done at secondary care, and out of them around 14 has been diagnosed as a cancer patient. So we can use the secondary care center as a tertiary care hospital. So today we also launched about one more program under this scheme with this project, which is 1 year, that I will keep for next year, not discussed much here. And yes, so we also during this, sir also gave, like, there are emergencies when we need to transfer the bloods. So we did collaboration in NCR with UP and Delhi colleges, JIIT, Lady Harding and JIMS, and we did blood and blood products validation, how we can transfer, what is the effect on that. So we completed this thing. So not going into the detail or these things. So all of these, whatever we conducted, so where we kept very less focus on the drone part. Actually, there was lots of technicalities. We were there. 1 minute left. It is enough. Next year. So this was. Sir, thank you. So next, just many more things are coming for next year that we are going to present next year. So actually here we did a collaboration with almost 6 and 7 ministries: Ministry of Home Affairs, Ministry of Communication, Ministry of Civil Aviation, and the state government, 7 state governments, and the airport authorities, many more. So there were 50 or more partners that we did. So this is still going on, and we are just looking what next task sir will give us. So thank you.
Thank you. So before I think moving ahead with the program, I'd like short interventions from a few people that I am going to call on, because you did not raise your hands. starting with Professor Vineet Ahuja, who's sitting behind. I can see him. If Dr. Anurag Agarwal is here or has left? Okay, if not, then I will. So any reflections that you have, Professor Ahuja?
Because I think I'm just enjoying the program. It's a wonderful program. And what I see out here is that when people are presenting and other people listen, it, I would say, invigorates everyone, inspires everyone, and people already are talking about next year. It's not this year. They're already talking about next year, and I think this is something which is going to encourage the research system in the country a lot. It is going to lead to a lot of initiatives from other teams. A lot of ICMR institutes are also going to look forward to it in terms of looking for awards next year. So I think it's really wonderful. I'm just sitting and enjoying the presentation, everybody's presentation.
Thank you. And Professor
and out
Ahuja?
here, like, okay, on a, let me say, like the study about the COVID vaccine. Well, there was something which I would say that was a great presentation in terms of that COVID vaccine did not lead to sudden cardiac death, but at the same time, the public health message out there in the secondary outcomes was very interesting. That if you smoke, you don't die, but if you exercise a lot, you die.
So Professor Ahuja has been one of the inspiring inspirations behind this kind of a celebration and getting together. And he's been urging me to have even bigger meets of people across the country. So you were not here in the morning. I know you couldn't come. I have said that next time it will be 2,000 people in Bharat Mandapam. So we've already decided. And it will be many, many more institutions and a new format. So there will be truly, somebody said that today we had almost Filmfare Award type of presentations, thanks to our compare. And I was thinking that, yes, we would have Oscars next year. And that we will not tell 3 teams will be invited. They will not be told who is the winner. So 3 short things would be displayed and only then one winner would come. So that people have, there are more people around, and it is actually truly not only those who come for getting the awards, but also are participating in this general celebration of excellence. I'd also like to invite Professor Mishra, if you would like to say a few words, and I have one or two more people. Unfortunately, I'm not finding everybody, but I will call on one or two more people if, yes.
Thank you, Professor Bayal. I think it's been a wonderful day here, even though the time given to attend was very less. But then I think all the presentations were very good. I think it's just the tip of the iceberg that we are seeing there. And I think it's going to inspire a lot of people to be doing much more work, better work, and I think it's going to, with people get together and show that more and more people, you will have that big critical mass of people with more innovations and more people working towards innovations, and that Make in India, I think that for non-communicable disease, that was a wonderful thing. The drones, you can expand to whatever way you want to, and thank you. I think if I would not have come, I would really missed something very interesting and important, and congratulations to all the winners. And I think next year, as you said, it's going to be a big thing. Sure, we look forward to it. Thank you.
Thank you. If Dr. Joseph Matthews is still here, maybe he has left. Okay. Would you like to say a couple of words? Thank you for coming from...
Yes, sir. Thank you very much, sir. And first of all, a big congratulations to you, sir, and your leadership, and for Dr. Katoch, sir, also. I'm in fact so much enthused by what I'm hearing and seeing that I think it is time now for us to think of stepping up the game even further. I'm seeing the day when the drones will be now in a kind of traffic jam, one lifting a biopsy sample, another one delivering a vaccine. And maybe ICMR should start thinking of guidelines of how to regulate this and how we can actually dovetail in such a manner that one drone is used with maximum efficiency for delivering or transporting multiple things. And the same I'm seeing also with the platforms which are being used for the diagnostics. Now, CRISPR is a word we've heard so frequently today. And just like we've had the diagnostics, which is now able to combine cardiac, liver, pancreatic, and kidney in one platform, maybe we can think of having multiple diagnostics in one thing. I think what we're looking at is the horizon scanning for what we can listen to in this hall or other halls in about 2-3 years' time from now. Congratulations, sir, and thank you very much.
Thank you. Thank you. Finally, Dr. Neeta Bhandari to get a voice from outside the institutions, from an NGO, and a wonderful researcher herself. Dr. Neeta, any comments?
Thank you. I am actually really overwhelmed today with the quality of the way this program was organized, and also the quality of everything that was presented. This is, well, I haven't ever seen anything like it, especially drones. And I was thinking when I saw the fascinating drone taking off, I thought, I had only seen this at US weddings, and they used to really fascinate me. But this is amazing. So congratulations on the Foundation Day. But as is your trademark, you have already started putting pressure on everyone about these closed envelopes and the Oscar-like ceremony. Naro was saying, I'm already getting tense, and I said, me too. So thank you.
Thank you. My job is to put pressure. Thank you very much. Thanks all everyone. I don't know if anybody else wants to make a final comment. Otherwise, given that people will have to get trains and planes out of here, I would like to move on with the conclusions, because Dr. Smt Patel will do a quick summary, I guess, and then we will end. I don't need to make any comments further. Thank you.
Noted, sir. Well, as we draw curtains to the presentations, sir, your words from the podcast, if I may now speak, they resonate to what this day has been like. And I quote, sir, no matter what institutions do, no matter what funding is available, no matter what equipment or infrastructure for research is available, eventually it is the people, their mindset, the mindset of the researchers that will make India great in health. So more power to all of you, each and everybody here, for a brighter and a more healthier tomorrow. Well, with these words, may I now please request you, Dr. Smt Patel, the Additional Director General, ICMR, for her closing remarks.
Thank you. For the sake of, in the interest of time, I will keep it very brief, because summarizing today's whole celebration of science and whole celebration of teamwork will also take time. So I was just analyzing, because after our DG sir and all the experts and dignitaries have given their words of wisdom, to deliberate on the presentations may not be prudent and apt. I was just looking at what has been cross-cutting and what has been the underpinning highlights of today's event. The first thing which was very much resonating, very much visible, is teamwork. It was teamwork, teamwork, and teamwork all through, and teamwork between institutes, teamwork between scientists, and teamwork between ICMR, non-ICMR institutes, and NGOs. The best example which was very evident was the monkeypox, wherein everybody, each one contributed to the best in the interest of the nation. So congratulations, that was very amazing, the teamwork, all the three teamwork, so amazing, be it iDrone and be it monkeypox, or be it all the presentations that we had. And second T, what I found was equally important, equally impactful, was technology. Everywhere, every presentation had technology, but yesterday now Paul sir is not here. Yesterday he told that ICMR should have a fourth vertical, that is technology. And this technology was so much present in today's presentations that we can say that ICMR has now embarked, and also along with its non-ICMR institutes, the era of digital health and digital technologies for each one's health. And all the presentations were so much topical in nature. They were addressing any problem, all the problems, be it NCDs, be it leprosy, be it tuberculosis, or be it stroke, all were very topical in nature, another T, and all had some or other translational value. It was not something for the doing academic exercise. It was something which was leading to a translational value and which had potential to be taken up by either policy or practice or program. So that means, that is what our DG says, meaningful research. Research is meaningful if it can be adopted and adapted eventually for people's health. And another T, which was very important, it was that, of course, two T's. We really forced people to keep time. Timekeeping was very much evident and everybody was kind of hurried. And another T, I saw that people were willing to compromise their vital slide, but not compromise with Thanksgiving. So the last T was what I found to be really, very, very impressive is that everybody was more passionate about Thanksgiving, and that speaks bounds and too much about our culture. We truly believe in giving the due acknowledgement that everyone deserves. Having said that, I think we really need to acknowledge the judges. I was wondering really the difficult challenges of all the judges who selected these presentations, because identifying 1, 2, 3 among the best is the most, I think it is even more difficult than the Oscars and the Filmfare Awards, sir. I hope all of you will agree with a round of applause for all the judges. And all those who have not received or not got awards, please don't get disappointed, because you know that those sir has already promised that it is going to be closed envelope and going to be more glamorous. In fact, we were discussing that it doesn't look like a research presentation, it looks like more of something festival kind of thing. But science has to be celebrated, then only we can practice in day to day. Something we really enjoy must be practiced or can be practiced day to day. And all the awards that have been delivered or been given, what exactly the studies, if we see that most of the studies were very decisive in nature, especially Dr. Manikam's study, which really made us say that no, it's not because of Covaxin, it's something else. We cannot attribute the certain tests in young adults to Covaxin. And they were also giving some definitive answers. For example, the pre-diabetes burden. That was something which told us, or which tells us that we really need to design and develop prevention models. And diagnostics, another D, that is diagnostics was playing a major role in all the presentations, and most importantly, to quote our dear Katos sir, making a difference. That's another D I found is very common in all the studies. So I think all of us, all the young scientists and all their mentors deserve a big round of applause. Today's event has been overwhelmingly brilliant. And sir always says that anything can be achievable if we need, we should have 3 M, money, men, and material. But another M is very critical, motivation. And sir, we should hold such kind of events to keep the motivation going and the momentum going. Let the spirit of innovation, teamwork, which has been ignited in this platform, grow ever and ever and glow forever. Thank you.
Thank you. I said I will not speak again, but I forgot my acknowledgements. And I'll take just 1 minute. My personal first and my inspirational acknowledgement is to my own mentor, Professor M.K. Bhan, who you all know and who guides me not only every day, but every moment that I spend. And I truly miss him. And I really think that if he were around, it would have been so much more fun. He would have made today such great fun that I just miss him even more. But coming to the acknowledgements also, the support of the ministers that we have got in ICMR, Dr. Mansukh Mandavya, and now Shri J.P. Nadda ji, the way they have, now they are looking, the government is looking at Department of Health Research, and in general science and technology is very different. And if that support were not there, you heard the minister today, Anupriya Patel ji, that political support and the vision of the Honorable Prime Minister to make India into Viksit Bharat, if that driving force were not there, then a lot of what we are doing, we would not be able to do. But I also want to acknowledge all the previous Directors General, Professor Balram Bhargav, who could not join today, but Dr. Katoch is here, Dr. Soumya Swaminathan, Dr. Nirmal Ganguly. But right up to earlier directors today, I heard people saying, oh, but this was something that Dr. Ramalinga Swami started. And I'm glad that it is, coming to fruition. So I think all the previous leadership of ICMR is in this 113 years checkered history needs a great round of applause for taking this forward. Thanks to all the previous DGs and to all the directors of the institutes. The only thing I don't like about directors is thanking ICMR, because I don't understand that. Because you are ICMR. So who are you thanking? So please don't thank ICMR, because you are ICMR. You are in fact, for me, every institution in this country is ICMR. We are not, the headquarters of ICMR is not ICMR. Please don't make that mistake. We are just facilitators. Every institute of Indian Council of Medical Research is ICMR. In fact, every institute that does research in this country is truly part of the Indian Council of Medical Research. So thanks to everybody, all the ICMR, not ICMR, all medical and health research institutions in this country, and all the researchers that come from there. But I'll be missing my acknowledgements if I did not bring the people who organize. They have really surpassed my expectations, not only anybody else's. So I did not expect this to be conducted so well. Where are the others? Shyamjit, others? ये क्या हो रहा है भाई, जल्दी आओ, दूसरों को भी बुलाओ ना आगे। आ जाइए मैडम, आप कहाँ, आप भी आओ, आप भी खड़े हो। चलिए वो लोग, that team, let us give them all a standing ovation. Well done. And to all of you, all the researchers who have done this, without you, it is essentially all the researchers of the country that do all the work. It is the people. And that is the learning, not only my learning, it is my learning from Dr. Bhan. He used to say, पर लोग कहाँ हैं? यहाँ हैं. Thank you.
And may I now please invite Dr. Sarita Nair, the Head Policy and Communications, ICMR, for a formal vote of thanks.
Short.
Sir, even that job was done. So, so we all thank you, sir. A leader who is transformative, who's a transformative leader, who empowers, motivates, and elevates everyone to achieve their best. So thank you, sir. Sir is the force behind organizing such a big event. And this is an inspiring DHR-ICMR summit. This would not have happened without the research which is behind it. So we at ICMR are committed towards strengthening the research even further. Thank you so much.
Thank you. Thank you all.
Arogyam param bhagyam, swasthyam sarvarth sadhanam. Wishing you all a very happy and a healthy life, and a healthier India lies in your hands. So more power to you. Arise, awake, and stop not till the goal is achieved. And with that, we draw curtains to today's summit. Thank you.